And I'd like to introduce you to the people on this panel. I am not going to read bios because I did that for their individual lecture, so I'll just tell everyone who everyone is. The first person here is Brenda Davis, and Brenda has spoken at our conference before. Her YouTube videos are some of the highest viewed videos that we have, and she offers us she's fighting hard for us. She reads all the data, all the studies, and puts it together so it's easier for her. So I'd like to welcome Brenda Davis.
Thank you. Thanks, Steve.
Dr. Kim Williams, the past president of the American College of Cardiology. We feel very fortunate to have a cardiologist who also is an expert in nutrition, reads all the studies, and is willing to spend his time. This is not the most profitable way for a cardiologist to spend their time to come to the Real Truth About Health conference. This is purely for you. There's no incentive other than someone who's truly on your side and wants you to be aware of this information. So thank you, Dr. Williams. Dr. Gabriel Cousens, he has not only someone who reads the literature, but he also has spent many, many years at his Tree of Life Rejuvenation Center in Arizona, where people came to him. He monitored them, tested them, and fed them a specific diet. So when he talks about diabetes, it's not a theoretical thing. It's what happened year after year, every single year, for a very long period, watching the real effects on people from eating his diet. So he is someone with very specific and valuable knowledge, and we're very grateful that he's been willing to see us. So, Dr. Gabriel Cousens. And many of you are familiar with Dr. Joel Fuhrman. He has spoken before. He's had the highest rated video, the highest viewed videos of any videos we've ever done. A lot of people relate. I mean, it seems like there should be thousands of doctors doing exactly what he's doing, saying the exact thing he's saying. So he's very unique, but he shouldn't be. It seems like what his message should be the same thing that everyone says, but we're very fortunate to have someone that has been devoted to helping us get this information straight. So, Dr. Joel Fuhrman. Okay, so I'd like to ask a question that I know already there's a difference of opinion. And let's start by saying that there's been people in the keto and the paleo community. Specifically, I saw a Joe Rogan podcast with Dr. Joel Kahn and Chris Kresser,
Yeah.
And they were arguing whether saturated fat and cholesterol, dietary saturated fat and cholesterol, led to higher actual levels of dietary fat and cholesterol, and whether that actually led to a higher rate of death. And Chris Kresser was saying that just because you eat cholesterol or saturated fat, it doesn't mean your blood cholesterol goes up. And even if it did, there were 9 studies on longevity, and there was no connection between cholesterol and death. So I asked this question last weekend to Alan Goldhammer, Michael Clapper, Brian Anna Marie Clement, and who was on the panel? Michael Clapper, Pam Popper. And very clearly they were saying that higher cholesterol and higher saturated fat was correlating negatively with people's longevity. It was bad for them, and there was a correlation. So that was my thought. And so anyway, so the paleo people were saying that high cholesterol is not a problem, and the whole food plant-based people were saying, yes, it is a problem, and the studies show that. When I spoke to Dr. Cousens, or I heard Dr. Cousens' lecture yesterday, I thought you were saying that cholesterol of 160 to 260 was actually better for depression, preventing suicide. And I just want to clarify where everyone's thoughts are on what is the appropriate level of cholesterol. I was under the impression that a whole food plant-based diet is ideal, and that leads to an under 150 level of cholesterol. If each of you could just try to help us clarify this, so I can make sure we all understand this. And if I asked the question funny, please help me to make it straight.
Okay, I'll dive in. So my contribution to this panel probably would be that we have an intense relationship between cardiovascular mortality and LDL cholesterol. So we're all surprised at the European Society of Cardiology to find out that high levels of HDL cholesterol, which we've been thinking for 40 years is protective. Turns out it actually is not protective, that higher levels of HDL are associated with increased levels of heart attacks. So then you have the attempts that we've had over the decades to increase HDL cholesterol. Very famous studies, torcetrapib, anacetrapib, dalcetrapib, niacin, all of them failed to decrease cardiac events. So at this point, we would say that the HDL story is probably, we may need to learn some more about it, but right now it's not something that we can use. Okay, therefore, if you imagine what happens to someone with a low LDL and a high HDL, maybe they're not as good as they should be. And that what that really means is that any study that was done with total cholesterol only, without regard to what the LDL was or the triglycerides, it's just adding some information, but it's not going to clarify anything. It probably adds more heat than light. And so you can come to a lot of different conclusions. And in fact, we're trying to get all cardiology out of measuring the non-HDL cholesterol or staying with what the LDL cholesterol is, because that's where we really know that for every 1 millimole, which is about 39 on your American scale, milligrams per deciliter, for every reduction of 1 millimole, you get about a 22% decrease in cardiovascular events. That's data that comes from the trialists, the cholesterol trialists. That's a massive amount of data collected over numerous years with a variety of circumstances, some statins, some diets, some Mendelian randomized trials, which requires a one-sentence explanation. There, you can actually do a clinical trial based on people's genome if you have their data. And everyone has so-called SNPs, single nucleotide mutations that will actually change their cholesterol, and you can follow what happens to them naturally, and that's so-called Mendelian randomized trials. They all show the same thing. So I would say that whatever people say about total cholesterol, I don't know what that means anymore, but I know what it means with LDL cholesterol. Lower is better.
Hey. There's a question.
Do you want to?
Yeah. Do you want to explain, because maybe let Dr. Cousens address what this is about?
Well, I want to start with a few things. First of all, this 5G thing is really important. I just handed a 11-page document. It's 5G with the 20,000 satellites. We're talking about disrupting the Schumann resonance and the global electric circuit, which all of life on the planet is attuned to. This is not such a good thing, right? There is, in the end of that, all the organizations worldwide they're struggling against it, and we actually do have a solution to defeat them legally and lawfully, which is use of UCC law, which has worked with the smartphones. So they have the document over there. It's on my website. I love you to read it because it's got to be a worldwide effort to stop this from happening. Okay? So in that context, because that's really a big problem, we can talk a little bit about this. And what you told me was really interesting. Actually, really interesting. So the diet I mentioned, and then I've studied with clients over the years, lots of clients, but at least 120 in one series, is that a 25 to 45%, really 25 to 35% complex carbohydrates, 25 to 45% only plant fat, only 10 to 15% protein. Now, the significance is, which is really cool, what you just said, is on this diet, the drop in LDLs, which we measured, was about 70 points. It was huge. So people went from, close to 150 or more, really down to 69.
There you go.
So that's exciting. That just changes my discussion about it. Okay? Did everybody get that? So, and I'm going to tell you something else to think about. Because in answering this question, it's really more complex, which you pointed out. It just can't say cholesterol in, cholesterol out. It doesn't work that way. The body is homeostatic. The liver makes 75% of the cholesterol. If we take too much in, it'll make less. If we don't take enough, it'll make more. Where we're going to is where the body wants to go to is homeostasis. Around 150 or something like that. Now, I compared my study with Dr. Esselstein's and one other study, and those two studies were 10% fat. Mine was, as I said, 25, 45%. All three diets lowered the cholesterol. All three diets, relatively speaking, lowered the LDLs, but they all lowered the cholesterol. So now we're saying, what happened? 10% did it, 25 to 45% did it. What's going on here? And I looked at it because it's like you got to make sense of it. And what I saw is, what did they have in common? No junk food, okay? No GMOs, no white flour. Oh, wow, that's shocking. No white flour, no white sugar, okay? And they're good, and it was all organic. So what I saw in trying to make sense of it, like, okay, you got a 10%, now you got 25 to 45% according to the Constitution, is the real factor was people were eating in a healthy way, which was bringing the whole body into homeostasis and lowering our LDH went way lower. Actually, there's more to it, but it went way lower. But they all went down. That's my point. Cholesterol, total cholesterol, all went down. I know that doesn't matter anymore, but in the moment it mattered. Okay, so it's kind of exciting to kind of move away from into a more holistic viewpoint. Is does it matter with the cholesterol? Okay, now I'm getting back to the kind of the bigger question, because you see, we could talk all day on this, right? I'm tempted to do that, but I won't, okay? So what I see is, of course, according to Constitution, we're going to need different levels, but eating healthily is the most important thing. There are lots of studies out there that show that high cholesterol can be a problem. There's even more showing it doesn't matter, if you're between 160 and 260. Now, what you heard from me, Steve, wasn't that. The real problem is low cholesterol. As a psychiatrist, it's a nightmare to think, hey, we have something, if your cholesterol goes below 150, that's going to give you a 4 times higher rate of depression, and if you hit the lowest level, 6 times higher rate of suicide. Plus, more accidents, more violence, more Parkinson, and a greater cognitive decline. Now, that concerns me. That's very hard data that we worry about, versus, hey, as you pointed out, the cholesterol thing, I'll have to move this way. The cholesterol thing isn't quite so clear now, unless we look at LDL. So that just changes everything in a way. So, so the real message is kind of eating healthily as a way of bringing all levels of your cholesterol to normal homeostatic levels. That's a kind of a way to think about it. But as I say, we got a huge drop. That was a 46% drop in 3 weeks of the LDLs. So if that's the problem, we have a solution with this kind of diet that's 25 to 45%, plant saturated fat. So those are some thoughts to consider in this more complicated situation. I hope that answers the question.
I could just add one or two things, and that is, number one, we know that as diets are higher in animal products, both cancer rates and heart attack rates increase as a proportion of animal products as the total proportion of calories go up. And the mechanisms via which animal products increase heart attack and cancer death isn't always via increasing LDL cholesterol. There's other mechanisms which diet higher in animal products increase causes of death. So just looking at the cholesterol in a vacuum doesn't tell us all the answer. And furthermore, we also see that diets higher in nuts and seeds result in lower rates of cardiovascular death and lower rates of total mortality in more than 8 different significant meta-analysis encompassing hundreds of thousands of lives and tens of thousands of deaths. We always give studies more credence when they look at hard endpoints like death compared to soft endpoints like cholesterol levels. So we know the diet that's maximally protective, and we're all recommending similar diets, so to speak. And I'm also suggesting that there's no evidence that focusing on the fat content and trying to arbitrarily get your fat content below a certain number is going to benefit your heart or your cholesterol. It's the overall nutritional quality of the whole diet, so we're in agreement on that.
Yeah, nice.
There's also a concern, though, which I did mention, that on vegan diets, certain genetic types who have lower rates of conversion enzymes don't make ALA into DHA as efficiently as other genetic types do. And we did a study on 166 vegans. I shouldn't say we did a study. I was not involved with that study. As president of the Nutritional Research Foundation, our foundation funded the study, but I wasn't part of the study. Different scientists did the study. And when they tracked the DHA levels of 166 vegans who were not supplementing with DHA, a certain percent of those, approximately 25%, had a significant deficiency of DHA, and it didn't correlate with the type of fat they were eating, if they had flax seeds, if they had walnuts, if they weren't eating oils. It showed that the conversion enzyme genetically was more correlated with the amount of conversion from ALA into DHA. And those people would be more prone to depression and shrinkage of the brain. So maybe certain types of individuals may be more susceptible to depression when they're on a fat-restricted diet that's not supplemented with DHA. And so we're trying to make sure a vegan diet is safe for all people and being conservative and careful in making sure that people who are prone to not producing DHA don't get into trouble on a vegan diet, because it's not about heart disease so much. It's about them not getting depressed and not developing dementia later in life due to severe DHA deficiencies. So that may be the reason you're seeing some people with low DHA increasing their risk of depression, because those may be the people that would have done better with more fish, or if they were eating more, their cholesterols might have been higher, and the lower cholesterol in combination with the low level of DHA may be, on a vegan diet, may be increasing the risk of depression. Just something we should consider, because we don't have all the answers, and when we have to make judgments, we have to do it conservatively and make sure we're not hurting people. You know how they say, first do no harm. We have to be more careful. In my experience, and I think Brenda's too, is that the vegan community very often speaks as if they know everything, and they proclaim something that nobody has to worry about this, and you get plenty of DHA in a vegan diet, and and there's they make blanket statements for all people, and we just have to be a little more careful here.
Great. If I could just say, that's so right on. Everything you said is just perfect. I have, as a psychiatrist, it's wow, this is a problem. The DHA, EPA, if it's low, you're going to have a much higher chance of depression. My study suggests maybe 90% of the total U.S. population is deficient in DHA and EPA. And I treat, for example, post-pregnancy depression. Those are all women that get deficient in DHA because the baby needs the DHA. And all you need to do is give DHA, and it goes away. The key here that I've gotten to a point on, because so many people are deficient, I'm really just giving DHA, EPA as a supplement. I use a plant-based one because of just what we're saying. It's just like the B12. Some people are going to be low, some people aren't. But it's safer with the safe thing like DHA, EPA to just give that to everybody. because what Joel's saying is really, really important. It's really right to the point.
And I would add that it's important for people to understand when we talk about DHA and EPA, people often automatically think, well, that means I need to eat fish. And it's true that fish is the major source of EPA and DHA for a large part of the population, but it's important to understand that fish don't actually make DHA and EPA. It's made by tiny plants in the ocean called microalgae. And so what we can do is, instead of raping the oceans and extracting the oils from fish, we can actually culture the plants and extract the EPA and DHA from the plants and provide it, as Dr. Cousens said, and Dr. Fuhrman, in a supplement form that's actually vegan and comes from plants. And so it's just important to know that you don't absolutely have to have fish. And then the other thing, this is not really my area of expertise, but one of the things that I wonder about, the depression that you are seeing associated with low cholesterol levels, the thing that comes to my mind right away is, what about all of the populations of some of these longest lived, healthiest people in the world that have very low cholesterol levels and yet very low depression rates? So is something going on with the individuals you're seeing where there's a metabolic abnormality, that it's combined with the DHA EPA thing? They're not as efficient at conversion because their enzymes have been depressed because of bad diets over time. So there may be some other factors, because we do have populations where average cholesterols have been around 100 or 120, and they've done very well, lived long lives, and still super productive when they're 90 or 100 years of age.
Just a question, because I'm seeing mostly European and American clients.
Yes.
Are these populations you're talking about fit that description?
Well,
because there may be a genetic factor here that you're talking about.
Yes, and so many of them are Asian populations, many of them are South American populations, and then if we think about the blue zone populations, which includes some Europeans, but also the Okinawans and such. So it's just, I think there are still a lot of unanswered questions. But and then the other thing that I want to bring up is just the whole saturated fat has been vindicated, because a couple of resources that I think are worth you being aware of. And one is the 2017 presidential report on fatty acids and heart disease. And I'm sure, the American Heart Association presidential report, Alice Lichtenstein, and a very, very well-qualified group examined the literature, and it's a very comprehensive, very helpful report, and it looks at everything. So basically, the evidence is overwhelming that saturated fat increases LDL cholesterol, and LDL cholesterol increases risk of heart disease. Now, if you replace one of the mistakes that was made, and there were a couple of studies that came out that indicated saturated fat was not an issue, but what was actually found was that if you replace saturated fat with refined carbohydrate, you're at no advantage at all. If you replace saturated fat with polyunsaturated fat, you reduce your risk about 25%. If you replace it with monounsaturated fat, you reduce your risk about 15%. If you replace it with complex, like I think they look specifically at whole grains, you reduce your risk by 9%. So that's replacing saturated fat. And then the other thing to be aware of is this study called the Chowdhury trial from 2014, which showed that saturated fat does not increase risk of heart disease. One thing to know about that study is it was really riddled with errors and omissions. And one of the things that was done in several of the studies that were part of that meta-analysis is they actually controlled for cholesterol. So they controlled for the factor that causes, that can cause heart attacks, which is just, you can't do that. Another thing is that, and I think this may be the most important thing, is 19 out of the 20 studies that were included were comparing within populations, people eating 11% saturated fat versus those eating 13%. Or in Finland, I think it was around 14%. And they compared within populations, but they didn't compare between the populations. And if you looked at the people with the highest rates of heart disease in Finland, they had over 4 times, it was 4.4 times higher rates of heart disease than people who were eating the lowest saturated fat in Japan. Well, there were no differences within the 5 or 6% of saturated fat in the Japanese, but there sure were between. And the only group that they actually looked at people consuming hugely different amounts of saturated fat was the EPIC-Oxford trial, which was included in that meta-analysis. And in EPIC-Oxford, the people eating the least saturated fat had almost 3 times lower risk of heart disease than the people consuming the highest amounts of saturated fat. And I actually contacted one of the authors of that study to ask her, what's up with this when it first came out? And you know what she told me? She said when they first did the analysis, their study actually showed a 19% increased risk with higher saturated fat. Then they reworked the analysis because they were rejected. It was nothing new. So the study was rejected. They reworked the analysis, took out some of the studies they were using, and then got this new finding that saturated fat didn't matter. And she said, the one thing I would tell you is this study in no way, shape, or form changes anything about what we should be saying about saturated fat. Saturated fat increases LDL. We know that from 50 years of clinical research. We still need to be telling people to restrict saturated fat.
I think Brenda's bringing up a real important point. They've even said now about 50% of the studies, like in the New England Journal, are altered or bogus. That really makes life hard, okay? Because, like, what are you going to trust? It's like an accumulation of studies you have to look at. Anybody know who Ansel Keys is? Okay, so in 1953, Ansel Keys studied 22 different countries about the theme of cholesterol and heart disease. 6 of those countries showed that people who had a higher cholesterol had more heart disease. 16 showed the other. He only printed the 6 and made his theme that brought this whole cholesterol thing on, okay? If he had combined all 22 together, it would have shown it didn't really make a difference. So life gets hard when you're trying to be a scientist, trying to figure out all these things, when the people doing the research are altering the research to kind of make their point. So it isn't easy at all anymore. So that's kind of a complaint that's coming out that the scientists are making. It's like, how do I trust this? So thanks for bringing that up.
It's not true, Lance. Not an easy topic when we see a lot of retractions these days. I would say that fabricating or altering data is probably less common than starting off with a particular point of view or bias, finding a study that supports that, or doing one, and then going ahead and publishing it. It's so-called positive publication bias. That is, if I think something is really important and I study it and I don't find that that's true, I'd say, oh well, go on to the next project. That negative finding never gets published. So we do have flaws in the way that we do things. We're trying to make it better. Having clinicaltrial.gov, if we're going to do a big clinical trial, I should submit it. Everyone can look at it. And then years later, when I haven't published it, somebody could call on the carpet and say, hey, what happened to that study? Well, it was negative. Turns out that it wasn't true. And so we are trying to make it better. We're trying to make sure that there's good disclosure so that the relationships with industry and financial incentives to sort of come to a specific conclusion are at least transparent and hopefully not going to continue to influence the way science is done. I do want to make one point that hasn't come out yet, because we've talked about so many things, and it goes a bit back to what Dr. Fuhrman was saying. It's more complex than LDL, even with saturated fat. I mean, we've pointed at those two things for a very long time for heart disease. But now we know, in the last 5 years, we have so many publications of other things that correlate with the development of diabetes, stroke, heart attack, death, that we really ought to be paying attention to. And so I'm just going to, if those of you who are listening tomorrow, sorry for the preview, but I would say the top two, and I don't have a randomized trial to tell you which one is more important, so I'll list them both as a tie for number one, would be heme iron, which you get from eating animals' blood. And the other one would be TMAO, trimethylamine N oxide. This really emphasized by the Cleveland Clinic. Hopefully that will be a serum test that everyone can get. Those two are very toxic in terms of development of plaque and development of ruptures and unstable plaques. So heart attack, stroke, death, heart failure correlate with both of those. There are also other ones. We've known about C-reactive protein as a marker of inflammation, interleukin-1 as a marker of inflammation as well. IGF-1, when you're eating animal protein, you're getting a hormone that actually increases diabetes, death, as well as strokes. And the other two that may turn out to be very large, we've known about having eating phosphorus in large quantities, hurting kidney function, which then produces cardiovascular disease. And the last one I'll mention is SUPAR, something that's studied a lot at Rush, at Emory, and in Boston. SUPAR stands for soluble urokinase plasminogen activator receptor. That actually is another test that can be done, and you can find that if you do a healthy lifestyle, you can drop that level. So why go through all those markers and potential risk factors? Because people don't eat saturated fat, they don't eat cholesterol, they eat food. And when they're eating food, they're getting a variety of things, and we may be looking at LDL when it's really been the heme iron the entire time. And so, I'm not going to, volunteer to eat the blood of the iron, to try to figure out, is it cholesterol crystals? Eating those would be worse. And so I think we should stick with the theme that there's a lot that we don't know, that medical knowledge doubles every 2 years. I'm sure that's going to continue to happen, and we will hopefully a couple years from now have this conference and say, we didn't know this back then, but now we know the answers. It's probably all of the above, though.
I just want to say, I know this is not that important, but I just feel Ansel Keys is being attacked unfairly and has been attacked unfairly, and there's twisting in the interpretation by the paleo and meat-based community to make it look like he twisted his studies and did things wrong, and I think that's unfair, unjustified, and incorrect. The reason he left out some countries is the data wasn't sufficient to include them, and there was lots of and he was not a researcher that was trying to twist information and produce bad research. So even though he's dead, I just feel we shouldn't be smearing his name. I'm just got to stick that in there. I'm sorry.
Just to clarify, if someone is eating a whole food plant-based diet and their cholesterol is, 125, Dr. Cousens, are you recommending that they do something to raise that cholesterol so they're not in that under 160 zone where you're saying there's more depression in the studies you found?
Yes. Particularly if I'm seeing clinical symptoms. I mean, people come in, just like Joe was saying, or at 125 or 130, and in the bigger picture, particularly if they have depression or they have some kind of other issues going on mentally, I will want to get them up to at least 150. Coconut oil works most of the time. Besides, it's good for Alzheimer's, but it's really good for getting it up there. It's about on a vegan diet, that's about what we have.
But there's no randomized trial evidence for that yet? So it's a hypothesis?
It's more of a hypothesis. People have used it, and I've just used it clinically with pretty consistent results, but it's at a clinical level.
Joel, Brenda, if my cholesterol is 125, do you recommend I take coconut oil?
No. absolutely not. And now, not to say that you couldn't eat some coconut and enjoy. I generally prefer for people to be getting their fat from whole foods, to be getting their carbohydrates from whole foods. So I would say if you're eating a super low-fat diet, that you could afford to eat some nuts and seeds and avocados and coconut even. But I wouldn't say pour coconut oil over your food. I don't think there's any really strong evidence. And as a matter of fact, the studies I've seen really haven't even, it was addressed in the presidential report, the whole coconut oil thing. I think it was addressed very, very well. So, I mean, my cholesterol has always been around the 130. I have never been depressed in my life. And so I think there are a lot of really healthy people with cholesterols in that range. So I think we need to take it on an individual basis. If a person's showing signs of depression, then you need to see what needs to be done. And I would try super healthy diet. I would try adding the EPA for sure, or combination EPA, DHA, and all of those things first. But that would be my approach, and we all have different approaches, and you do what you find works.
Do what we need to do to help the people, and I think in defense of Dr. Cousens, he's not recommending people take coconut oil to raise their cholesterol. He's just saying in his patients that were depressed, he's doing what he needs to do to help get them not depressed, and that seemed to be helpful for them. He's not recommending all people take coconut oil whose cholesterol is low. He's just trying to help his people who are depressed.
Thank you. And I don't take coconut oil.
Just to clarify, Dr. Cousens, if my cholesterol is 125, are you yes or no recommending I take coconut oil?
To clarify it again, if you have symptoms like depression and other mental symptoms, as I said, then that will be a definite consideration. But I personally don't recommend that for everybody, and I personally do not take coconut oil. Just to be clear about it, okay? It's a treatment for a series of symptoms that could make a difference.
What is that saying?
I don't know.
Okay, so next question. Wouldn't it be simpler to, instead of having a 10-day conference, instead of giving individual lectures, to just tell everyone in 5 seconds, everyone should eat beans instead of animal products? Because everyone already is aware that vegetables are healthy. Isn't that the punchline of the entire thing, is beans? That's what you replace all animal products with. That's how you get full. Because everyone has always known that green vegetables should be part of their diet, but I don't get full on just salads. I am not satisfied with lettuce. I'm not satisfied if I add kale. I feel like I'm missing something, and maybe it's just me, but to me the answer is always beans. That's what fills you up. Is that what you're saying, or you have a different explanation of that?
Why are you leaving out nuts in that? And why are you not eating fruit? But certainly beans, I think, are an excellent food and should be a major portion of all our diets, and we're all agreeing on that for sure. But it doesn't have to be only beans. There are other good foods to include in our diet as well. Quinoa, nuts and seeds, other foods we can eat that are healthy too.
I mean, if you look at the data about nuts and seeds, if you're just eating nuts and seeds occasionally, you'll drop your mortality rate by 7%. If you're having it once a week, you drop it by 9%. If you're having it 2 to 4 times a week, you drop it by 13%. If you're having nuts and seeds, which I do every day, you're going to drop your mortality rate by 20%. That's pretty simple, and it's good and healthy.
Okay, and aside from beans, when it comes to grains, is there a hierarchy? Is quinoa, millet, amaranth, teff, and buckwheat over here, and then the glutinous grains, wheat, barley, oats, rye, are those a less desirable grain because they have gluten? Is that an accurate way to think about whole grains? Anyone?
Yeah.
You go, Brenda, first.
I don't think so. I think that if you look at sort of grains, we have grains and then we have pseudo grains, which aren't true grains. I think the problem with gluten-containing grains may be the glyphosate that's sprayed on them. If we look at long-lived, healthy populations and people who are using traditional foods, I just ordered some black barley, which is an organic barley that's a heritage seed. I think that these foods really can be part of a healthy diet. They are satiating. They aren't as nutrient dense as vegetables and some of the other foods, but I still think they have a reasonable role to play. And so obviously if you're sensitive to gluten, then you need to select pseudo grains. But and even some grains, some true grains don't have gluten as well. The grains that have gluten, of course, are wheat, barley, and rye, and any combinations of those like triticale or kamut or spelt. But I personally consume those grains, and often I sprout them, and they go into my breakfast bowl, and I love them sprouted, and they're filling. But sometimes I cook them as well. But the one thing that I do with grains is I keep them intact. So they provide everything wonderful that was intended, and there's, everything of value is still there, and nothing has been added that's damaging. It's as they were picked from the plant, and I think those foods can have wonderful value.
I agree with everything Brenda said, and I just have to add, and you could tell me if you agree, is that lately I've been telling my patients not to eat brown rice anymore. Not to eat white rice because it's too glycemic, and not to eat brown rice because it's too contaminated with arsenic, due to growing it on cotton soils that have been treated with arsenic fertilizers or certain pesticides against the boll weevil, and then they use chicken manure to fuel the rice patties, which is the chicken's been treated with arsenic, and the outer surface of brown rice sucks up arsenic more effectively than other foods. But there are some rices that are grown by natural Indian populations that are raised on natural marches, and they're knocked down with the sticks into the canoes that aren't raised commercially, and those may not have arsenic in them. So I've been more cautious in the last 2 years in my own diet about trying to not eat brown rice and substituting quinoa and other intact grains like you are, because of that arsenic concern.
So my take on the arsenic has been, I'm really concerned for people that are eating rice on a daily basis, as a lot of Asian populations do. The amounts of arsenic in rice do vary. I believe the California rice is a lot less contaminated than the rice from the deep south where they had the cotton fields. And so what I normally tell people is, it's not that you absolutely have to eliminate it, but it should be just a very occasional, if you're out somewhere and they're serving it, rather than a kind of a staple in your diet, for sure.
Agreed.
And I eat it myself very rarely now. I tend to do other grains instead. It definitely is one of our more significant sources of arsenic, as is hijiki seaweed and as is chicken. So people, it was interesting. I just have to add this because a lot of people are big on bone broth right now. So I did a search in PubMed to see if I could find any studies that substantiated all the claims about bone broth. And they are just amazing claims about bone broth. And I found 10 studies that came up about bone broth and health. Only one study concerned human health. And the study was a study on chicken bone broth that showed that the levels of arsenic in organic chicken broth were so high that they exceeded the maximum levels recommended, and that practitioners, physicians and healthcare practitioners needed to know that this was a concern. They needed to warn their patients against consuming organic chicken broth or any sort of chicken broth for that matter. So just something to be aware of.
So just to clarify, when it comes to beans, are there any beans you're not recommending? And aside from brown rice, are there any whole intact grains, organic, that you're not recommending? Or are you saying any whole grain except brown rice and any bean is okay? Or are there any that you're saying we should avoid?
That's correct. You have it correct.
They're all okay?
They're all okay to me.
Unless you have gluten sensitivity.
Okay.
And the thing with beans would be just that some beans are safely sprouted and can be eaten raw, like lentils and some of the really small, small lentils, mainly peas, can be sprouted safely. But the larger beans tend to be high in some lectins that are, you really can't be consuming them raw, so they must be well cooked. So that's the one caveat with beans. Sorry, I'm not supposed to look at Steve. I'm supposed to look at the audience.
And what about seeds and nuts? So seeds, we have sesame, sunflower, chia, flax, pumpkin, hemp, organic, raw. Are we saying they're all good all the time? And when it comes to nuts, are there certain raw organic nuts that we're saying you can have too many? How should we, with celery, there's no limit, eat as much as you can. When it comes to seeds and nuts, is moderation better? How much do you recommend? Is it okay to just eat as we want?
Why don't I tackle that first? Is that I think that we're very clear here that people can overeat calories in general, and overeating calories can put more fat on your body, and more fat on the body is not health favorable. So it's not, the question isn't about really eating more seeds and nuts, it's whether you're overeating calories in general. And sometimes you have to watch your seed and nut intake so your level of calories is not over the amount you should be eating each day. So, but in any case, given the framework that we're agreeing that either moderate caloric restriction or body weight plays a role in health, we shouldn't be over-consuming any foods that leads to obesity or overweight or an overweight condition. That said, eating nuts with meals in a moderate amount is part of a whole healthy diet. Whether your diet has a little more fat or a little less fat, or a little more nuts or a little less nuts, as long as the calorie content is favorable, shouldn't affect your health and may even be an important factor to improve your health, to have a little more nuts and seeds, as long as the calories are favorable. So it's not something you have to really moderately restrict, it's that your overall diet, because when you're putting the nuts in as a substitute nutrient, in other words, I'm putting a little more nuts, I'm eating a little less potato, I'm eating less rice, I'm eating less of something else. So I'm still keeping my calories relatively favorable, and there's no problem with eating those nuts. Nuts have a bad rap for no legitimate reason, but excess calories deserve the bad rap.
I couldn't agree more with what Joel just said, and of course I just ran down about eating nuts regularly is going to give you, every day is going to give you a 20% decrease in your mortality rate. That's a pretty good thing. According to your constitution, some people can have more nuts and seeds and actually do better, and some people can do less. However, I'm going to use the word mTOR pathway, and it basically speaks to between 35 and 70 grams of protein gives you optimum anti-cancer and longevity. So you never want to overdo it. 70 grams isn't a whole lot for people who need more protein, and 35 for people who don't need. I'm a kind of more low protein person because my constitution does better with that. So I think there's a range, and if we keep in that range, we're going to get support of optimum health, longevity, and cancer prevention. That's the only thing I would add to it. Some people have liver gallbladder troubles. Okay, fine. Don't eat a lot of nuts and seeds because a lot of people have digestive problems. But aside from that kind of thing, you have to find the right range according to your constitution. But it's an essential part, from my point of view, of a healthy diet.
And I would add a couple of things. First is that I think Dr. Fuhrman has mentioned this in his lectures as well, but certainly nuts and seeds nuts in particular have about 600 to 800 calories a cup. And so it is possible to overeat them, but we probably absorb about 25% less calories from nuts and seeds than what you see on any chart. So you lose some in your stool. The other thing I would say about nuts and seeds is that a lot of people, the nuts and seeds they consume are not in an ideal form. So often they're coated in chocolate, or they're covered in salt, or they're covered in sugar. And so when we talk about nuts and seeds, we're really, the best you can do with nuts, for example, would be to soak them, sprout them, dehydrate them, and rather than roasting them, which can produce some acrylamide and products of oxidation, most of the studies on nuts and showing beneficial effects don't distinguish. They are using roasted nuts. They're still valuable. But to make them the most valuable, you want to reduce anti-nutrients, release stored forms of nutrients, and not add to the acrylamide content and so forth. So that's one thing. And then the second thing I'd want to say is with seeds, you want to make sure, now seeds are actually more nutrient dense than nuts. So they have more protein, they have more trace minerals, more iron, more zinc generally than what you would get from a similar amount of nuts. So they're about probably 12 to 15% of calories from protein, whereas nuts are more in the 5 to 8% range. So the other thing that you want to think about is when you're doing your mix of nuts and seeds, you want to make sure that some of those are rich in omega-3 fatty acids. So seeds, a lot of seeds are rich in omega-6s, and as vegetarians, we're relying on conversion at least somewhat, and we want to make sure we have a source of omega-3 if we're not obviously eating fish. So including some chia, hemp, flax, some walnuts is a good idea in that mix.
Very good. And can you imagine that? That's made a really important point you just made that nobody considers, that the nut studies showing that how beneficial they are at extending lifespan are done on roasted nuts, and they still show incredible benefits. You know what I mean? Imagine if they really did them on the healthier nuts. It just gives more support to what we're saying.
Yeah. And in supporting what Brenda's saying too, we always soak our nuts and seeds. It gets out the anti-hemoglutins and antitrypsin factors, which block your digestion there. So we always soak them, throw away that water, and that makes them a lot more digestible as well.
There have been times when I've taken a big bowl of chickpeas and wild rice and eaten the whole bowl and gone and done a blood glucometer test, and my blood sugar was raised. And I was a little confused because I'm thinking, well, I'm eating whole grains and beans. This is nature. But my blood sugar clearly is going up. There's no question that, I just ate, so that makes it go up. But it went up a lot more than when I have a big salad. So that made me think, am I supposed to be, I know that white sugar is bad and refined pasta is bad, but now I'm eating beans and grains and still getting a rise in my blood sugar. And I was a little concerned that maybe I'm not supposed to just be eating a giant bowl of cooked beans and grains where a giant bowl of salad seems harmless. Can I get myself into blood sugar problems or type 2 pre-diabetes or type 2 diabetes by just eating big things of beans and grains with, maybe without the salad? Can you get in trouble blood sugar-wise with big things of beans and grains?
Well, I can take it. I mean, absolutely. And one of the things when we started doing our research in the Marshall Islands, one of the biggest shocks I got was we started, with bowls of barley, bowls of brown rice, and allowing people to take their own. And their blood sugars were through the roof because they took 2 or 3 cups. And so I think, Steve, that what you really want to do is have massive amounts of greens, and the grains and beans are what you sprinkle on top. And so because of course, the carbohydrate content of beans and grains is far higher than it is, especially grains, because of course beans have a very low glycemic index, as do greens. So if you make it mostly greens and beans, and then you throw on a measured amount of the starches, whether it's sweet potato or whether it's barley or whatever it is, that needs to be measured according to your energy requirements. So some people need a lot of calories. Some people, especially people with type 2 diabetes, don't. And many times they are quite carbohydrate sensitive. And when you do the non-starchy vegetables and beans as the things that really fill you up and fill your bowl, and put more measured amounts of the more concentrated carbohydrates, I've found it to be much more effective. And so I think that's a reasonable. Anybody?
Thank you, Brenda. And Brenda and I it's just amazing that we're like, I guess, sisters or brothers or whatever, because whatever she says is right. But nevertheless, what I'm adding to that too is that Americans are used to overeating all the time. We've been indoctrinated since birth to eat large amounts of food and overeat, and it's been like into our social network that bigger babies, getting puffier cheeks, the cute fatness, shoving food into your baby's mouth, and people are habituated to overeating, and when they go onto a healthy diet, they might overeat on these things. And you can overeat on, so I think that we're saying that when you eat more greens, more salads, more green vegetables, mushrooms and onions, things that are lower glycemic and lower calories, it fills you up to a degree and makes it easier to control your appetites. You're not overeating on the more calorically dense food. So we don't want to overeat on nuts. We don't want to overeat on grains, because we want to keep our calories regulated so we're not overweight, right? And I made the additional point is we even want to undershoot our caloric needs by a little bit. And this helps us do that. All these techniques you're learning up here help us undershoot our calories a little bit, to slow our metabolism down a little bit, which makes us age slower. And we already know that if we put up the thyroid, because we slow our metabolic rate, our body temperature goes down. Our respiratory quotient, the amount of calories we lose with breathing, goes down, and our thyroid slows a little bit. And having a little lower metabolism so we can eat less and not get too thin is a way we can age slower and even protect ourselves more. And if I'm putting out that range of free T4, the lowest range to the highest range of the normal range, we know that in the lower half of the normal range, we have half the rates of heart attacks compared to in the upper part of the normal range. So it's beneficial to moderately slow our metabolic rate, which means you moderately eat a little less calories. You don't overconsume calories and stuff yourself to being full at every meal. What you're talking about, Steve. You still could overeat on certain foods, even if they're healthy.
So I think all 3 points have been made. I couldn't agree more with. Okay? The best exercise to do after eating is pushing away from the table before you're full. Got to have a little bit of sense of humor about it. But in terms of the diabetic treatment program I have, we really don't include grains or beans until people are substantially healed, minimally with a blood sugar of less than 100 for that reason. And then you can add them, and then if you're more sensitive, then you add less. But grains are a lot more carbohydrate intensive than beans are. So I just put that in perspective is first beans, legumes, before we start talking about grains. And you can see if your system can handle it or not. So, but in terms of treatment, bigu. It's Chinese for no grains. Okay? For treatment, let's not confuse treatment with maintenance. 2 separate things.
Gabriel, you and Dr. Brian, and you and Brian Clement have both said that you've come to the conclusion that fruit is been hybridized to be sweeter than it was in nature. It's picked unripe, and you're both saying that when people have health challenges, that even though it's fruit, it still has sugar in it, and it should be avoided if someone's has a health challenge. And if someone's well, it still is something that you're saying should be very moderate. Most of the other whole food plant-based people have a more open approach to fruit and are saying it's definitely part of the program. How should everyone be thinking about fruit? In other words, I guess I'll say more clearly, Brian Clement is saying that the fructose in fruit is sugar and that it's not different because it's in fruit, and it's kind of an unpopular opinion. It's not repeated by many other people, but he has said over and over that when they've done live blood testing over the years, that the sugar in fruit feeds yeast, mold, fungus, and cancers. And I've asked him it 150 times because I want to eat fruit, and he's been very adamant, and I think you've been sort of supportive of it also. Do you want to clarify on fruit, what your thoughts are?
Yes. Let's start with, again, as a medical treatment first. Diabetes, I don't suggest people have any fruit because of the fructose, and I'll explain that. Cancer, the same thing. Fructose feeds, let's say it this way, cancer cells love glucose 10 times more than the normal cells. And cancer cells love fructose 10 times more than they love glucose. That's one problem. Another problem, because I do a lot of work with people with cognitive decline, is that fructose activates the glia cells of the brain, overactivates is really a key word, and that's 10 times more than normal, okay, than glucose. And when the glial cells of the brain get activated, it creates a inflammation. And inflammation is a driving force behind cognitive decline and Alzheimer's disease. So kind of talking on that level. Now, in terms of, okay, your diabetes is done, your blood sugar is, perfect, 70 to 85, everything's good, then fine, let's say you can have some fruit. Now, in my studies, there's about at least 8 studies out there, there's only 3 fruits that don't seem to raise your blood sugar. Now, fructose doesn't raise your blood sugar, but directly. But and it's bilberries, blueberries, and green apples. So I say, fine, you want some fruit, get started. Blueberries are pretty good, a really good way to start. So that's another consideration. A third consideration is some people are saying more than 15 or say 15 to 25 grams of fruit, it's like 2 bananas or something like that, is pretty safe, meaning it's not having a negative impact. When we start, the average American runs about 81 grams of fructose. Fructose in excess, we mentioned 2 things, well, 3 things. Accelerates diabetes indirectly because it disrupts leptin, insulin signaling, and a few other things, which really are a problem for diabetes. Fructose inflames the brain. Fructose is associated with increased excess fructose with heart disease, gout, kidney stones, cognitive decline, and Alzheimer's. So excess fructose is what we're looking at. So a little bit of fruit doesn't seem to be a problem. And so I'm not quite as strong about it as Brian, but he is treating a lot of cancer people, and fructose really feeds cancer. So I think we're coming from clinically, hey, that's really emergency if you have cancer. You need to do everything you can not to aggravate the cancer cells. I mean, attempt them, feed them. So, but once we're clear of that, of the diabetes and cancer, then a little bit of fruit is, I think, fine. It's really not, as far as I can tell, not a problem.
So it's time to, as the cardiologist up here, time to confess that I carry them around with me wherever I go. But those of you, again, I'm going to preview my talk for tomorrow. Sugar, whether it's a sucrose, fructose, galactose, really does produce an insulin response. And to the extent that does that, it really does harm the cardiovascular system. Makes your LDL cholesterol more dangerous by glycating it, okay? Decreases your HDL cholesterol, increasing your triglyceride. What is triglyceride? Well, it's supposed to be fat. Well, you give sugar to your liver, and you will make fat. And so that insulin response is associated with higher blood pressures, with more blood vessel damage, more vascular events, heart attack, stroke, and death. And so I usually, more in my nuclear circles, make the analogy that, everybody knows what a nuclear reactor is like, and you've got all this uranium, plutonium, and it's going to go nuclear, so to speak. If you don't have control rods, which are usually cadmium, you need something in there to stop that horrific reaction from happening. Well, we actually have that in fruit. It's called fiber, okay? And so I would encourage anyone who's concerned about it, I can't tell you exactly, but going to a lot of vegan conferences, I've learned that about a 4-to-1 ratio of sugar to fiber is what makes sure that you do not get that horrific insulin response. And so that 4-to-1 ratio, if you look at something like Snackwell's, it's 22-to-1. That's really not what we want in terms of sugar. And there are some fruits that are extremely high in sugar and very low in fiber, notably grapes. And so once I read that, grapes and raisins, I put them on a salad or something like that. I wouldn't eat them by themselves. But there are some fruits that are extremely high in fiber, such as, some have been mentioned, blueberries, but blackberries and raspberries are much more high in fiber and less sugar, and therefore you're not going to get that dreaded insulin response.
That's really good. Can I go on that? Because I'm in the same boat as you. I actually treat a lot of diabetics and even cancer patients the same way. But in any case, I just want to make two things clear. What you said is that we generally recommend that people eat a low glycemic diet. And for example, white potatoes are more glycemic than fruit would be even. But we find that one piece of fruit with a low glycemic meal, with a healthy meal, with vegetables and beans and mushrooms and, and onions and tomato, that one piece of fruit does not raise the insulin response in an otherwise healthy meal. And that in treating my diabetics, I have one right in my clinic right now who was a type 1.5, I think, who came in with a glucose of over 500. But we're feeding her with some fruit, but we're giving her, like you said, we're giving her wild blueberries, not regular blueberries, because the wild blueberries are low glycemic. We're giving her kumquats that we grow, kumquats and passion fruit and guava, and that's it. We're just giving her lower sugar fruits, and we're keeping her sugars really well. And right now, she's down to like 2 units of insulin with each meal on a type 1. You know what I mean? So we're almost getting her with favorable sugars, and we're not preventing the highs and lows. And so we measured it. We measured both the insulin response, the glucose response after the meal, and we're able to and there are some fruits that in nature are not that sweet, and have been shown to have excellent protective effects against dementia and against cancer for their bioflavonoid and flavonoid intake, and they're high in fiber, and they're not that highly glycemic either. So it depends on the person, but for most healthy people, there's nothing wrong with eating almost any type of fruit if you're having certainly like one piece of regular fruit with a meal, and for those that are more sugar sensitive, there are still some fruits that they can safely eat.
And I would add that if you look at the research, very consistently, the amount of fruit people eat is very consistently associated with reduced risk of disease, heart disease, and all-cause mortality, and everything else, diabetes and cancer and so forth. So I think that's one thing to consider. And then the other thing to be aware of, and this is really new information, so it may shock everybody at the table here, but there was a 2018 report from Cell Metabolism that actually put a tracer on fructose to see what was actually happening to fructose. We used to always think that fructose got shuttled straight to the liver, and that the liver had to deal with it, and it would either get turned into fatty acids or it would get turned into glucose to be used as energy. We now know that that's actually not true. What happens to fructose happens largely in the intestinal tract. There are enzymes in the intestinal tract that convert about 86% of the fructose you eat into glucose before it ever enters the bloodstream. And so only about 14% gets through. And so the amount of fructose you're eating in fruit, it doesn't all get into your bloodstream. When people run into trouble, and actually what they showed was that when you're getting it in fruit and you've got all of the fiber and so forth in the fruit, that's an amount of fructose your intestinal tract enzymes can handle quite nicely. What the problem is when you extract fructose from foods and concentrate it and add it to processed foods with no fiber, then you overwhelm the intestinal tract's ability to convert that fructose to glucose, and that excess fructose gets shuttled to the liver, and it does some damage. I mean, it really is more damaging significantly, as Dr. Cousens said, than glucose. And so we don't want to overwhelm the system with fructose, but the easiest way to overwhelm the system is consuming concentrated fructose, as in sugar-sweetened beverages, for example.
Or agave, what's that called, agave nectar?
Agave nectar is mostly fructose. But even table sugar is 50% glucose, 50% fructose. High fructose corn syrup is about 55, usually 55 fructose, 45 glucose. Well, sucrose is 50-50. It's not really that much difference. The difference is, of course, in sucrose, it's a disaccharide that are bound together, and you have to cleave them apart before you absorb it. Whereas with fructose, with pure fructose, it's a single molecule that gets absorbed probably even more quickly because it doesn't have to get broken down. But just something to be aware of, that it's a little bit of a different metabolic process than we used to think it was. So we're just starting to learn about the metabolic fate of fructose.
For someone who has blood sugar issues, do you still recommend cooked squash as a part of their diet, such as acorn squash, butternut squash, Hubbard squash, spaghetti squash, pumpkin, sweet potatoes? Is this something that we should be trying to include for healthy people? And for people with blood sugar issues, should we be including or avoiding that?
I include it. I think that the squashes are wonderfully nutritious, high-fiber foods, help to fill people up. And of course, again, because they're a little bit higher in carbohydrate, I would just moderate the quantity somewhat. I think those foods are really good choices as our carbohydrate sources. But again, it depends on caloric requirements and how much weight needs to be lost and so forth.
A lot of times...
Well,
Sure, sorry, go ahead, sorry.
So the hypoglycemia issue is a little bit more complex. Back in 1979, I put an article in Pavel Rolo's book, Hyperglycemia, A Better Approach, and pointed out that you can have hypoglycemia from adrenal imbalance and pancreas imbalance and thyroid, pituitary, and pineal, or all of them combined. So really, if we're going to be trying to treat it, we have to address all those potentialities in the endocrine chain. So that's the first thing. Just diet really doesn't make a lot of, it's palliative. Now, so that's kind of the most important thing as far as I'm concerned, if we're going to even pretend to address the hypoglycemia issue. The issue of the squash and those kind of things aren't, from my point of view, they're complex carbohydrates, so they're going to go in more slowly to the system and not create that much of an imbalance. It's the really simple carbohydrates that are going to cause the most amount of imbalance and stress the organs trying to compensate with it. So I'm supporting there what Brenda said, but we have to see it as a bigger picture, and I think that's really key in that.
Right, we can score these carbohydrates on a hierarchical scale of quality and help the diabetic make better choices. And the hierarchical scale we're talking about here and all agreeing on is that refined grains are at the bottom, and then you go up and we check the fiber content, the glycemic index, the amount of resistant starch, the amount of slowly digestible starches, the micronutrient content, the fiber content. We consider that. We're devising the right diet for a diabetic, and we modulate the amount of those foods accordingly to get the results we want. So we might limit more white potato, limit more sweet potato, give more squashes, which are better glycemic profiles, and then give more beans, which have the best glycemic profile, and better than maybe some of the intact grains even. So we moderate that to get the results we're looking for. And we can utilize even spaghetti squash, which is a better glycemic profile than sweet potato would be. So we help people make better choices to optimize their results to get well. So
I take your comments about sugar very seriously. I'm very adamant about not having sugar. But freely, when I have a salad, I don't think twice about putting 5 tablespoons of olive oil or hemp oil or flax oil. It's a regular part of my diet. I don't eat animal products. I take the sugar part serious. I never add salt. I would never have soda or refined anything. But to me, for whatever reason, my brain thinks that when I'm having a big salad, that putting 5 tablespoons of olive oil or flax or hemp is appropriate. What are your thoughts about organic, extra virgin, cold pressed flax, hemp, and olive oil?
I think we already answered a lot about that in the sense that we've talked a lot about people consuming excess calories as a source of disease causation, and all oil is 120 calories per tablespoon. And we also discussed up here how walnut oil is not the biological same thing as eating a walnut, sesame oil is not the same thing as eating a sesame seed, and that the whole nuts and seeds in their natural uncooked states are safer forms of fat. and are a whole food that digests differently. They're slowly, the calories are slowly digested, not flooded into the bloodstream rapidly. The calories are not all biologically accessible. They're rich in fibers, sterols, and stanol that bind fat. They have different biological effects. So we're all pretty much in agreement that when we're looking for a source of fat, we're trying to pick whole foods, not processed foods like oil. And if you're putting a couple of 2 or 3 tablespoons of oil on your salad, you just added 500 calories to your salad. How do you expect to be thin with all those extra calories? You know, where you can't do both. You can do nuts and seeds and the oil. How many calories are you going to consume in one meal? You know, so you got to make a choice. We're trying to motivate people to make better food choices, and to pick that some foods are better than others, and to try to construct their diet in a way that's most favorable and give them these guidelines. And I think we're pretty much, it's really nice to see that we're kind of in agreement and encouraging people to make better food choices here, and that oil is not a favorable food choice.
And I would just add that the way that I view it is that oil is to nuts and seeds and avocados as white flour and white sugar are to high carbohydrate foods. It's the processed food of the fat world. Right. And so we've removed, one thing we don't want to remove is fiber, phytochemicals, antioxidants. Now, I believe that some good quality fresh pressed oils are more favorable. They have more redeeming value than sugar because yes. You enhance the absorption of some phytochemicals and vitamins. You've got some vitamin E there and so forth. But I believe you're always better off with the whole food because of the fiber and all of those other things. So what I do for my salad dressings, and I'm sure you do the same, is I use hemp seeds, or I use tahini, or I use some whole nut or seed or avocado to make the dressing. So it's a whole food-based dressing, and it's delicious, and you still get some healthy fats, but along with it you get fiber and antioxidants and so forth.
Right, and that's why I'm always saying that the salad dressing recipes are the most critical recipe, because we're making the salad dressings with healthy ingredients. We're not just pouring oil. We're blending nuts with some vinegar and maybe some tomato sauce or other types of things that are healthy, and so the dressing itself is healthy. And so we're not using commercial dressings with sugar, salt, and oil in them. But the dressings still taste great.
And the other thing to mention is quite often when people go on super low-fat plant-based diets, they end up using sugar dressings. So their salad dressings are essentially refined carbohydrates. It'll be maple syrup based or something like that. Sometimes a very sweet concentrated balsamic vinegar, which actually has a lot of sugar. And there's no redeeming value to those things. When you balsamic vinegar does have some redeeming value because it actually helps with nitric oxide production and so forth. So it has some redeeming value. But you would have probably even more redeeming value with something with a little bit of fat, because then you've got some absorption of more of the phytochemicals and so forth that are present in the salad. So I'd be really cautious about especially buying these fat-free dead dressings in the grocery store that are just sugar. You want to make your dressings from some healthy ingredients.
One thing too, all these salad dressings that are commercial all have canola oil in them, which is very, very deadly. People should really avoid any canola oil, organic or not. There's a whole list of reasons, but that's a big issue. Even when I fly, we make our own salad dressings, and basically we use a lot of seed sauce type things, some kind of liquid, because just a straight salad dry is a little hard. But the seed sauces, nut and seed kind of combinations with a few things, they really make good salad dressings.
Can I ask the panelists a question? Because there's some reports that certain types of flaxseed, because we know how beneficial flax seeds are, but there are some brands of flaxseed brought in certain areas that may have extra cadmium in them that is not favorable. So we're going to Canada to get flaxseed grown in Canada with lower cadmium levels. Have you guys heard anything about that, or a cadmium contamination of some flax seeds or not?
I haven't.
Okay.
Unfortunately, looking even at all organic, now even though organic food has less cadmium, it's still a bigger issue, even in organic food.
Yeah.
You know, it's really a hard one in the bigger picture.
So I've been trying to look up flaxseed growers and asking for the analysis of their food and their analysis and trying to pick the brands that are lower cadmium flax seeds, because I eat flax seeds every day, and I'm just so, are you doing the same?
Well, I have an issue with flaxseed just because they are easy to get oxidized.
We keep them in the freezer.
I keep them in the refrigerator, but I am cut down on the flaxseed because I can't totally control when I got it, how long it's been sitting on the shelf. I have some concerns about it because it's so easily to be oxidized.
Well, that's when if you order it from a grower directly as opposed to getting it off his shelf, you have more chance of getting a fresh product too.
Yes,
But
yes.
okay.
I'm a 55-year-old male, and my sex drive has gone down significantly over the years. And I'm wondering, is this normal for men and women in their 50s to have significantly lower sex drive, and that's just life? Or is there foods or supplements? I jog. Just the question: is this just normal, or is there something with foods or supplements that people should do to increase their sex drive?
For the first thing is it's not normal. That really people have normal sexual activity in their 80s. Okay, it's not normal to have a lower sex drive, and it's very common, but that doesn't make it normal. So there are many reasons people have men have lower sex drive, women have lower sex drive, and it's a more, let's say, complex thing than taking some kind of stimulant. Okay, you really have to do a whole person healing. What's going on? Is their thyroid low? Are their adrenals low and they're running out of energy? People are getting fatigued sooner and sooner in their life cycle. So it brings us back to how do we get a person really healthy? That's the way I approach it, rather than thinking that. But it's not normal from my point of view. And I think historically, as Brenda studies a lot of the cultures, people are having sexual activity, as they say, in their 80s, or even their 90s. It's not. That's more normal.
So I would add that I would add that it's really an issue of blood vessel health, vascular health as well. We have some publications out of University of Chicago when I was running a nuclear lab for a living, looking at the impact of abnormalities on your nuclear scan and correlating them with erectile dysfunction. That area has taken off, and there are actually now at least one randomized trial of going on a whole food plant-based diet and improving vascular health and improving sexual function. So people will commonly say it's a canary in the coal mine because they are the smallest vessels. As you're adding plaque to your arteries, they're going to be the ones that have difficulty first for a man. And so everyone who's had this issue probably we should be considering that as a risk factor or a telltale sign that there's actually cardiovascular disease, and do the appropriate workup.
To add something else is that it's more prevalent, obviously, in people who are not eating healthfully for other reasons too, because as you have a higher storage of fat on your body, fat cells produce more estrogen in males, and your estrogen to testosterone ratio goes down. And as your muscle to fat ratio increases, you also produce a better level of testosterone. So we see that when people are following an anti-aging approach, they're aging slower, they're staying younger, they're maintaining their sex drive, they're maintaining their testosterone better, and we're talking about maintaining a better muscle to fat ratio. So we encourage people to keep their body weight favorable at the same time as they exercise, particularly use bodybuilding type exercises to build muscle. So we want them to increase as an aid for people who are aging and getting lower testosterone, to work out, keep your body fat lower, and to have an anti-aging diet, and keep your testosterone high by building a little bigger muscles. Keeps your testosterone up.
No question, really, exercise does increase testosterone.
And exercise, of course, increases the longevity proteins, to what you were saying, mTOR, SIRT1, CMPK, AMP kinase, all these things that make for longer longevity are increased by caloric restriction, phytochemical intake, exercise, and reduced animal protein are the key factors, and reducing excess calorie exposure, do all the things that slow the aging process and prevent chronic disease.
And incidentally, for diabetes, when you give men testosterone, it really helps the healing. There's some people who have done research just giving them testosterone, and it reverses the diabetes. So it's actually a big deal, but men tend to get estrogenized. You see the big breasts. It's like, you have no question that they need some. I don't give testosterone per se. I give herbs that support testosterone function, but we see it very common in diabetes. Is excess estrogen really lower testosterone?
From a female perspective, are women in their 50s and 60s supposed to have the same sex drive, or a normal sex drive, or does it naturally decline as they go into menopause?
Well, there's going to be some naturally lowering of estrogen when they go through menopause, but keep in mind that if they're on a healthy diet before they go into menopause, they're producing much less estrogen than the average American. When they're producing much less estrogen already before menopause, then they've built up more estrogen receptors, and when they go through menopause, the drop isn't so much of a difference from where they were before. When you're on an American diet with excess fat and a high estrogen-producing diet, your body tunes down estrogen receptors. So now when they go through menopause and the estrogen falls off that cliff, their estrogen receptors were already low, turned down from the excess estrogen exposure, and now they have dramatic menopausal symptoms, which result in hot flashes, lack of sex drive, and increased risk of osteoporosis. So we're trying to get people to follow the right diet and have lower estrogen levels as a means of keeping the estrogen more stable through menopause.
And women who, in indigenous communities, who are living more naturally and with a more healthy diet, actually don't have much of a problem going through menopause. It's significantly less. It's more like a Western diet problem. So it's just making the point.
I'm agreeing with you.
And it's like, fine. It's not normal, in other words. But because we're living abnormally, we create abnormal situations. That's a key thing to understand. So it's not natural for a woman to really have a big drop in their sexual drive if they've been eating in a healthy way prior, so that they're coming in exercising and all these kind of things. They can pretty much fly through menopause. And a lot of women I work with really don't have problems with menopause for those reasons. Just fly through it.
I guess I'd like to direct this at Dr. Williams. I am a conference organizer. I have no background at all. I don't do research, and so I have really no knowledge of this. But I have come to the conclusion, or I'm very distrustful of industries, whether we're talking about the soda industry, the candy industry, the beer industry, the fossil fuel industry. I feel like they're trying to sell me, and they'll say whatever they have to do to make the sale. I sort of feel the same exact way about the pharmaceutical industry. So when they say we have a new drug and it works, I kind of feel, I read Ben Goldacre's book called Bad Pharma, and they convinced me that every clinical trial, not every, clinical trials, that there's so many opportunities for the pharmaceutical industry to have a way to influence it, to somehow influence or to stop studies or delete studies, and the end result that when the doctors get these studies, they're studies that were so influenced and affected by the pharmaceutical industry that even if a doctor says, look, we have 3 great studies, maybe there were 5 that they kicked out and never showed. So I kind of feel like, how do I really believe any doctor or anyone, or any doctor who says, look, we have the studies, if the studies themselves I don't trust? So I kind of feel like, I don't know, even if you say that the statin studies show that statins work, I'm thinking, who ran those studies? Who controlled them? Who influenced them? So how do we decide whether I should listen when a doctor or a smart person says the studies show that the drug is good or statins are good?
That really has been a concern, and there are a lot of financial motivations. It doesn't matter whether you're talking about the device industry or the food industry. It doesn't really matter. And that kind of relationships with industry, the influence of industry on scientific literature has been deep. It's been there for a long time. But there's no question that we have progressed. And so but let me ask you, before I give you the overall answer, Let me answer that one particular question. How do you know that statins work? Because it's breaking the Medicare trust fund. People are not well and they're not dead. Okay? And that, if you're the insurer, is putting you in deep trouble. Okay? So there's no question that statins saved lives, but it's not stopping, it's stopping progression of disease, but it's not curing people. So they're still seeking health care. Now, one of the things that I mentioned earlier was clinicaltrials.gov. That really is important because there have been instances, I'll try really hard not to say the name of the drug, where a major trial, everyone knew what the trial was going on, the trial ended, and then there was no results. And no one was talking about it. So this was over 10 years ago, I was sort of the incoming co-chair of the annual scientific sessions, and somebody on our committee said, why don't we tell that company that they have to present it at our meeting? We contacted them, they did, and yeah, it was a huge negative for their particular drug. And but when you call them on a carpet, they really did go ahead and publish the results. And that led to a change in the direction of how cholesterol drugs were actually being treated. And so physicians, societies, American Medical Association, we can all, the Food and Drug Administration, we can all hold each other accountable to try to help with the issue of pharmaceutical industry relationships that would taint the science to some degree. Now, being able to register all the drugs and all the trials, I think has helped a lot. So we do get negative trials. They may not get the biggest publication, but at least you know from that website that something was done in that particular area. So my biggest issue with them is probably not the level of science, because imagine this, imagine you're a drug company and you put out a drug that doesn't work or it's toxic, and you've somehow, gotten in front of the FDA and you've gotten it through on data that's fake. There's a big truth that's about to happen. That is, your drug will be released and it will be prescribed. And then you will have, in my career, there's a handful of drugs, Cerevistatin, Celacrine, drugs that had to be withdrawn. And those withdrawals are very costly. Your shareholders, your CEOs, all of them are quite upset because it's going to cost that company a lot of money. So you have a big, the fact that the drug is going to be widely distributed is going to tell you that'll hold people accountable, because the company will be sued for having, you see them on television. This is one of the most litigious societies ever, if not the most. You see them on television all the time. Did you bleed on this particular drug? Well, it doesn't matter that drug is half the bleeding of what we used to use. You're still going to get sued, even though it's better. The mesh for, I see that one all the time, the mesh for hernia repair. Anytime there's a recall, there's going to be a lawsuit. And so that unfortunately holds people and companies accountable as well. So if I have a problem with the pharmaceutical industry, it really isn't the accuracy of the trials, because they will be held accountable ultimately for that. It's the pricing. That, I know that's a little off topic, but I think it's important because we are talking about trying to maintain our Medicare system and decrease healthcare costs. And pharmaceutical costs are a major issue. And if you look around the planet, there are only 2 countries, the last time I looked, that don't have cost constraints, 2 developed countries, and that's the United States and New Zealand. New Zealand doesn't have this kind of an issue. They're very similar to Australia, where there are price controls. And I actually personally have talked to the president of Pharma, this many years ago, and said, why can't we rein in these costs? And the answer came back that if we rein in the costs, we will have to stop research and development. And so I said, so you're saying that that in Germany and France they can pay 30 to 50% of what we're paying, and the United States population has to bear the cost of R&D for all the drugs in the world? And there was a little pause, and he said, yes. I don't know how to get around that. How do you make it more? How do you make it easier to have drug development? Sometimes it takes 30 years and billions of dollars, and then they want to come back with a drug that costs $80,000. Well, if you're Harvoni and you stop the progression of hepatitis C, and you cure it instead of people dying, maybe that's worth $80,000. So it's a difficult area. I know that it's been a big political issue recently. Having Medicare be able to negotiate prices of drugs, I think, is something that many of us physicians would be in favor of for the benefit of patients, for compliance with and stopping disease. We're not there yet.
Maybe can I just add one more thing, is that I think we've just missed something, though, that's important. And that is, we're here to talk about lifestyle medicine and trying to avoid the use of medicinal substances, which don't get to remove the cause of the problem. And that we're talking about diseases that are caused by what people eat. And drugs enable people psychologically to think it's okay to keep eating the same diet that caused the problem to begin with. Therefore, it accelerates and promotes the progression of their illness, because because people think because their glucose looks okay, they can still be overweight and eat burgers and go to fast food restaurants and drink soda, and because their blood pressure is okay, it's okay to eat French fries and potato chips, and because their high blood pressure is okay. In other words, without the drugs, the doctors will be picking you up, smashing your head against the wall and saying, I want to see you next week, dropping 5 pounds, eating just vegetables, staying off salt, and I'll see you next week after you're walking an hour each morning and see if you look better. But now we give them a drug, and the person goes right out to McDonald's and have milkshakes and French fries, and they think they're okay.
I couldn't agree with Joe more. It's just so blatant. It's a hard one, but I do want to talk about statins a little bit from a diabetic point of view. On the average, and there are lots of studies, there's a 40 to 80% increase in type 2 diabetes in people taking statins. So some studies say 12%. It's going to vary. And it also is a genetic variation. So depending what your genetic background is, you may have 80% or you may have 40%, but that's huge, okay? And if diabetics take statins, which is very common because they're worried about heart disease, because 75% of diabetics will die of heart disease. So this is a big problem. So statins are even worse when they give them to diabetics. So I never use statins because we have natural ways to do it. It's called change your diet, okay? It's called fasting to bring these things down even quicker if you're really too high. So that's the point. It's like, this isn't hard, and the trouble with the drugs is that they become a substitute for doing the work of getting healthy.
So I try to simultaneously agree and disagree, but that's not possible, so I'll have to do it sequentially. Okay. I have many cardiology colleagues who will go out to eat with me, and I'm looking at that steak they're eating, and they're saying, oh yeah, that's fine, I'm taking my statin. And I completely disagree with that.
Right.
And we should be doing much more in the way of prevention. And yes, we are enabling by lengthening the people's lives. No question about that. However, the fact that the matter is the drugs do work, and that's why we're in such trouble, as I mentioned before, because people are living longer, sicker lives. Now, the part that
being healthy works too. That's the key.
It does, and that's why we're all here.
That's not quite accurate, because they would have lived much longer if they would change their lifestyle and
No,
didn't take the drugs.
right. That's what we're saying the same thing.
Okay.
That is, we need to be preventing diseases instead of pulling people out of the river. We should stop them from falling in the first place. And so we're in agreement about that. However, once you have people who are in trouble, there are things that you can do to help them, and the drugs do have a role there to try to reverse the effect. Somebody coming to me with 3-vessel coronary disease and having 70 years of a bad diet, I can do better with all guns blazing. Sorry, I'm from Chicago. That was a bad thing to say. But with a rehab program, adherence to medications that are guideline-driven, plant-based nutrition, weight loss, every aspect of it, we'd leave no stone unturned. But you're absolutely right. If we could, and this is why we're here, because we want to stop people from getting into that situation in the first place, and we should be able to. And hopefully we will get to the point where, why would we take drugs for something like that? For the diabetes issue, there was the CARDS trial. It showed a 23% decrease in cardiovascular events if you added statin. And it's interesting that the company that did that used a relatively low dose of statin. Why? Because it's high-dose statins that tend to increase diabetes. Now, implicit in what you said it was an 80% increase. If you increase from a 1% incidence of diabetes to 2%, that's a 100% increase. So the question is it clinically significant, and who gets it? It's people with metabolic syndrome, which goes back to Dr. Fuhrman's point. Why do people have metabolic syndrome? Because of central obesity. So if you did the right thing, you would. There are people who would tolerate statins and never develop diabetes because they have a good lifestyle. So these actually can work hand in hand. It would be nice if the drugs were unnecessary, but they can actually be very helpful. But I would never want to replace lifestyle medicine with drugs.
I'm from Chicago, too.
If someone leaves this conference and says, I'm going to eat a whole food plant-based diet, do they have to worry about deficiencies such as protein, iron, iodine, B12, DHA, vitamin D, DHA, taurine, vanadium, chromium, or anything else that meat eaters don't have? And how do you solve for all of these?
Can I start? because the protein issue is something that very sensitive. Just because I have a family member, my mom will kill me if I use her name. Oh, I just did. Sorry. Who actually is a raw vegan. But raw vegan, nothing wrong with being raw, nothing wrong with being vegan, of course. But if you are very restricted in what you're eating and eating just a handful of things, you better check the amino acid content of what you're eating. And so she ended up deficient in lysine, cysteine, and methionine, and that made her protein deficient. If you're generally protein deficient, you can get into some major trouble. So she ended up with 5 lobes of pulmonary embolism because she had deep vein thrombosis. Why? Because one of the proteins, or 2 of the proteins that you make, are natural anticoagulants, protein C and protein S. Without them, you will clot. It was hard to explain to this very intelligent, educated woman what was going on, because there's another protein, RBAP48, that if you don't make it, you can, and you don't have it in your hippocampus, you can't encode new memories. So every 15 minutes, she would ask me why she's in the hospital. Say nothing about the albumin and the pre-albumin, so her legs are swollen, etc. So everyone says that on a vegan diet you can't get protein deficient. If you do it really, really wrong, you actually can. Now, the reason to talk about that is because it's so unique. No one should be doing that. Everyone should be eating a variety of grains, a variety of nuts, and she still is a raw vegan, and all I did was increase from almonds to almonds, cashews, walnuts, pecans, and all of a sudden her protein's perfectly normal. So there is a little bit of a warning there, and I'd love to hear what the rest of the panel has to say, but I just want to point out one other thing. The thing that it can get deficient if you don't eat dirt is B12. And most people know that. They've heard it before. They're taking B12 supplements, and I just want to make sure that everybody saw the publication that said that if you are a male ex-smoker, you can actually increase your lung cancer rate, similar to the vitamin A studies years ago, if you're eating too much B12. And how much B12 supplementation, sorry, not eating, but how much B12 does it take? They said about 55 micrograms. Most of our pills are like 1,000. So it's stored well enough. If you're going to take 1,000, chop it into pieces or something like that, and take a little bit every now and then, and that should do it. Other than that, I don't have a lot of advice that we have to give people, except that business that I always say about rearranging your retirement funds because you're going to live longer.
Go ahead, Brenda. You haven't talked.
Well, I would say definitely there are some things you need to be conscious of. And I couldn't agree more about the protein. There's a real myth that we don't ever have to worry about protein. If you eat enough calories, it's just not an issue. But if you eat, you're eating more oil, more sugar, you may not get enough protein. If you're eating mainly fruit, you may not get enough protein. And I think the other thing is, if you're a senior, your ability to assimilate, you need a certain amount of acid in your stomach to be able to break down proteins. The digestibility is reduced as you get older, and so some countries actually have separate recommendations for people 70 plus for protein, and it's about 25% higher than for younger people. And the issue here is very simple. As you get older, you need fewer calories, right? And so you need more nutrients because you're not absorbing as well, and yet you need fewer calories, which means the whole point of nutritional excellence is magnified. You can't afford to be eating a lot of foods that don't provide nutritional value. So I think that's something to consider. And then the other things, B12 was mentioned. We absolutely have to have B12. Vitamin D, if you're living in an area where you don't have adequate exposure to warm sunshine, you would need some vitamin D, especially during those months. And then for some people, iodine, and especially in the countries where the soil iodine is low and you're not using, foods that maybe, the processed foods tend to have more. So because they're using iodized salt sometimes, or if you're not using iodized salt, not eating seaweed and living in an area with low iodine, iodine could be an issue. And then of course, iron and zinc, if you're not eating a lot, you're not eating legumes and you're not eating nuts and seeds. So there are a number of issues. So the bottom line really is you want to have variety and you want to be including a wide range of within sort of each food group so that you meet your nutritional requirements. And then of course, EPA and DHA, essential fatty acids can be an issue as well.
That was great. And taking it a little further, that the idea that when a person gets over the age of 75, their protein, ability to digest and make protein bioavailable goes down. But keep in mind that on a healthy diet of nutritional excellence that's slowing aging, like a nutritarian diet, that you're not going to develop that protein lower absorption at the age of 75. That may happen until you'll be 85 or so. You're aging slower, and your digestive capacity stays good as you age compared to an average American who's aging 10 or 20 years earlier than we're aging. So furthermore, it is an issue though, because IGF-1 is an issue where it gets too high, can promote disease, but it also, with lower protein bioavailability with aging, can get too low and accelerate disease. So there's no one size fits all, and some of these low-fat, macrobiotic type, potato-based vegan diets are not good for toddlers and young children because they're low in protein and fat, and they're not good for the elderly because they're too low in protein and fat. They might be okay for middle-aged, but by using hemp seeds and beans and Mediterranean pine nuts and more green vegetables and broccoli and things like that, and we're designing the diet to be more protein adequate as you get older, and making sure that we're maintaining people with enough IGF-1 so it doesn't drop too low. So the diet is more carefully designed and as a vegan, we want to make sure that we're not just assuming any vegan diet is okay for everybody, and we're making sure it's okay for people. The other issue is that the only thing we didn't mention, I think, was zinc that is absorbed about 20% over plant foods compared to 80% from animal products. And the ability to absorb zinc goes down with aging. And if you're not going to die of a heart attack or a stroke or cancer, a leading cause of death 200 years ago might be pneumonia or infection. So it may be true, it's hard to have enough data, but it may be true that lower bioavailability of zinc on a vegan diet with aging could have permitted an infection that occurred that didn't have to occur if the person had optimal levels of zinc. So we might be prolonging lifespan in vegans by giving them some zinc as they age to assure zinc adequacy without the consumption of animal products.
Nice. I'd like to add a few things to that. The first assumption is a meat eater is getting more nutrition than a vegan. I don't think that's true at all, okay? Both meat eaters, in the studies, maybe 40% of meat eaters are B12 deficient, maybe 80% of vegans. You're both B12 deficient, and that's only at 200 nanograms. At 450 nanograms, which is optimal B12, you're looking at a much higher percentage of meat eaters and vegans. So I strongly recommend people take a human active B12, not a synthetic B12, because it's a different frequency. So everybody needs that. Some research has shown that up to 96% of the US population, 70% maybe the world population, is deficient in iodine. That's a huge one. Iodine is the highest concentration of iodine isn't in the thyroid, it's in the skin. But you need iodine in the thyroid, you need iodine for brain. People who are low in iodine have lower IQs. Mothers who have adequate iodine, their children are born with 13-point higher IQ. They did a study in Indonesia where they gave grammar school kids iodine. In 3 months, their IQs jumped 8 points, and they were doing better academics. So most everyone is low in iodine, okay? Particularly in this country, particularly also since they stopped making iodized salt for whatever reason. I don't know what they were thinking. So iodine is another deficient. 85% of the population, as far as I can tell, in the U.S. is vitamin D deficient. The minimum is 30, but I like to see people around 80, but the percentages are 85% being lower than 30, and I see a lot of people come in with that. Again, vegan, meat eater, I don't think there's a big difference here in terms of what I see. So most everyone needs it. What you do need is a vitamin D blood test, though, to monitor how you're doing, because you do not want to go above 100. I'm kind of interested in, I think, what you said about vitamin D a little bit earlier, that in excess could be a problem.
Yes.
And it's
B12.
Oh, it was B12, I'm sorry.
Vitamin D in excess is a problem, too.
Yeah, I know, I got that. But I thought there was something else. But yeah, you have to keep your vitamin D, you want it not above 100, okay, period. And if you're going to do vitamin D, which you should, most people, you need to take vitamin MK7, which works with it so that the calcium from the stimulated calcitonin, it goes into the bones and not into your tissues. Okay. Now, meat eaters, the meat has less B3 and B6, so they're more likely to have those levels of deficiencies. So meat eaters are going to have more deficiency in some area, but the point I'm making is they're not so different than vegans. We tend to think, oh, we're vegans, we're going to be deficient. That just isn't the case. I pretty much will say most vegans I see are deficient in some of these things. So that's why I say B12 and is one, vitamin D is another that we just need to give attention to. I also agree with Joe about zinc. I've been noticing that also with people a little bit older, that there is a zinc deficiency pretty consistently. Not a good thing because of your immune system and so forth. So those are just some kind of overview type things. Now the issue of protein is interesting. A study, not that one study is the answer, but for people in the middle age, men, and if they were out of that mTOR pathway, excess protein, they doubled the rate of mortality and quadrupled the rate of cancer. Now they didn't say what that level was, but excess protein is really what we're talking about. Now, when people hit 60, 65, then that changes and people need more protein.
It wasn't 65.
What?
That was not true. The first group was between the age of 50 and 65 when they started the study. They followed them for 18 years.
Good.
So the second group was 65 to 85, and they followed them for 18 years. So they averaged around 77 compared to an average around 62. So I'm saying that it was a little older age than in that study you're referring to.
Okay, maybe if we're talking about the same study, because it was a little vaguer than that. It didn't have those statistics. But I'm not going to disagree. I think the problem is the trend is what the trend is. And I found out for myself at the age of around 70, and I was doing pull-ups, and I wasn't going beyond 25 twice a day when I was doing it. And I added 1 tablespoon of blue-green algae. And I went up. That was all the protein I needed. And I went up to, in a few weeks, up to 50 and making it up to 100. But the point I'm making is one little bit made a huge difference in my protein balance. Okay, so at 75, 76, where I am now, we can get really good health, up. Now I know not that many people do a lot of pull-ups.
You
okay?
can do 15 pull-ups?
I didn't say
At
15.
76?
I said 50.
You can do 50 pull-ups?
50. Well, actually, how about 80?
From a hang? Pull-ups from a hang?
Yeah.
Wow, that's unbelievable.
It's unbelievable.
That's
But-
incredible.
But
And 600 push-ups.
600 push-ups, right? Okay,
Wow.
but the point is, that little bit of protein pushed me from 25 all the way up to really, I hit 100 at one point. So it does make a difference. These little shifts make a real difference. So we do need to pay attention to those shifts with age. And so we have to look at nutrition, as you were hinting, in a life cycle kind of way. So, kids before puberty, they need a certain nutrition. And then, puberty to middle age, they need a certain nutrition. And then above maybe 60, we go over that. I don't know what study you're referring to, but I need to find it.
I'll show it to
you. Yeah. Because I had a kind of less detailed study.
It's 50 to 65-year-olds, followed for 18 years, in the highest tertile of protein consumption, had 4 times the risk of cancer, 75% increase overall mortality. Right. In the group that was older than that, that's 50 to 65, we're talking about now 65 to 80, followed for 18 years, those groups in the higher range, in the lower range of protein had increased mortality.
Lower range of protein.
Increased mortality.
That's right.
In a higher range
You
group.
got to go to more protein.
But it
with
followed for 18
age.
years.
Except for diabetes, they had 10 times higher
And they had more risk
That
of
was
diabetes.
The Levine study from
Yes.
2014.
Yes, that was the study in 2014. That's correct.
I mean, good.
But
I will
also
have to
that
look
women
it up.
have, and also that the iron issue is that women absorb iron at very different rates from one woman to another. So there's no cookbook approach, because like in the medical profession, we give the iron in a prenatal vitamin to all women. But if you look at the studies in more detail, you find that some women do better with iron and some women do better without iron because their ferritins are adequate, their iron level stores are good, and they should have been better not taking extra iron. So we're talking about individual, not cookbook medicine, but individualizing it to people's individual differences is what we do as nutritional specialists a little bit more, with a little bit better than most doctors would do.
Totally.
Okay. When we have this conference, we also make a video of it, and then we break it into smaller videos. I would like to ask the audience for questions. However, the questions only work if a person asks a direct question within 30 seconds, does not go into any more detail, and does not ask a follow-up question. Otherwise, on video, it's just a person going on, telling about their personal thing. So it's not what we would like to do. For anyone that can, in 30 seconds, say what they want to say and then hand back the mic, we would love to hear from you. And would one of you like to be in charge of calling on the person? Is anyone good at calling? Brenda, you want to be in charge of picking a person throughout the room so we can get to as many people as we can?
Sure. Well, there's a gentleman and the lady.
I'll be quick. My holistic oncologist also tells me don't have any fruit because of the sugar, but then he tells me to get it in vitamin form. Is that something you suggest?
To get what in vitamin form?
Like with your, let's say oranges, like you get vitamin C from that. So instead of having orange or orange juice, he'll tell me to take it in a pill form because you get the vitamin C, but you don't get the sugar. Is that what you suggest?
Well, from my point of view, I advise people avoid synthetic vitamins pretty much completely and take food concentrates so they still have the actual frequency of the real food. So that would work, but it's a concentrate, not a synthetic. It's not, for example, vitamin C. But ascorbic acid is not vitamin C. So it's the concentrate of it. So yes, that is what the kind of supplements I suggest.
Tell us about taurine. Taurine.
Taurine, yeah.
I think that's for you, Joe.
Taurine is an amino acid, and it's the one that's most likely to be low on an amino acid quantitative analysis in vegans. So taurine is the limiting amino acid on a vegan diet, and sometimes when a person is a professional athlete or competitive athlete on a vegan diet, we give them extra taurine for that reason. It's the amino acid to watch as you age, because that's the most likely one that can be deficient on a vegan diet. It's usually adequate though when you're in your regular, middle ages and you're eating a healthy diet. And as you said, on the diet style that we're recommending that has a degree of nutritional quality to it, we're more likely to see adequate taurine because people are not wasting their empty calories.
I will say that my experience with age and with cognitive decline or other kinds of brain kind of issues, often there's a taurine deficiency that shows up.
Just has to be said that in the cardiovascular space, you worry about taurine when mixed with caffeine in a energy drink, because it can people can develop arrhythmias, particularly if they get dehydrated. Then there have been several deaths recorded.
What is the actual amount? What is the actual amount of protein for a male 75 to 85? Well, again, as we've been saying, we are unique individuals. And so I'm going to come back to the mTOR pathway, which is 35 to 70 grams a day, which is way less than a lot of the high protein approaches are. So if you're kind of in that range, you're going to have the more optimal. But with age, you're going to need a little bit more protein, maybe 50. For me, it's about 50 grams. Okay? That's it. That's all I need. I'm a person that doesn't need much protein. I have to have a lower fat and protein diet for my constitution. If that answers the question. Now, you may need more protein, but 70 is where I would be a little careful.
We can see what person as they're getting older, if they're getting frail, losing muscle mass, losing strength. It's some suspicion maybe we'll draw an IGF-1 on them. And we'll see the average American's IGF-1 is usually around above 240 or is above 200. Vegans run about 150. We're trying to get people's IGF-1 lower. But if it's starting to get too low, below 90, or it gets 60 or 50, and when you're looking more frail and your strength is going down, then we want to increase your protein enough to get your IGF-1 maybe above 100. Yes, exactly. You can have a plant-based protein powder that would work. That's correct.
They seem to work really well. They're actually very high concentration of protein and assimilability. So that's a good way to spirulina, chlorella, blue-green algae, plant-based proteins, pea protein. There's a lot of range out there.
Right, but we find a lot of elderly vegans who are doing fine with their IGF-1 and their protein levels and don't have that problem with bioavailability going down. So we're all agreeing it should be individualized. We don't want to just make a blanket statement for all people like that.
And just so you know, the RDA for protein is 0.8 grams per kilogram body weight. And what we've seen is that in the vegan community, people that get too little protein actually have increased risk of fracture as well, of bone fracture. So it is important to get enough. Now, 0.8 grams per kilogram, if you're eating a very whole food plant-based diet, so no processed foods, and you're not eating tofu and soy milk, for example, then sometimes we would suggest adding 10% to that, just to allow for the reduced digestibility of protein from high-fiber plant foods.
And as edamame and tempeh and dried soybeans are also excellent sources of protein, besides the hemp seeds and those high-source protein plant foods too.
Hi, I wanted to ask a question that I've been a vegetarian a long time, and my issue is I have MTHFR-AA, and I have difficulty having enough iron. So what can I do to increase my, so I am worried, blood cells, I guess, and iron? I take iron, the liquid, but it doesn't seem to work.
Who asked the person?
I can take that. It's challenging for some people, for sure. Now, you want to make sure you're looking at not just your serum ferritin, but your hemoglobin and hematocrit as well, because serum ferritin does tend to run a little bit lower in people eating plant-based diets, and This is thought to actually be quite an advantage because high iron levels tend to act as a sort of a pro-oxidant in your body and can actually increase your risk of disease. So having a lower serum ferritin and a little bit lower stored iron tends to be favorable, if anything. You don't want it too low, but somewhat low. But in terms of increasing your iron status, one of the things that you want to do, there are really two things. You want to reduce the inhibitors of iron absorption. So for example, the two biggest inhibitors are phytates and polyphenolic compounds like tannins in tea. So when you're eating your meal, you're not sprinkling wheat bran on your breakfast cereal, and you're not drinking a cup of tea with your meals. So you would separate tea from your meal by a couple of hours, because you can actually reduce iron absorption by 90%. But, usually 50 to 90%, but with the cup of tea with the meal or with the bran sprinkled on top. So that's one thing. And the second thing is you want to enhance the things that help you absorb iron. And there we're talking mostly about vitamin C and organic acids that would come from fruits and vegetables. And also there are other novel things like carotenoids in carrots, like some of the compounds in ginger and garlic that can actually enhance the absorption of iron as well. So you're going to maximize those things that help you absorb it. So if you're having beans, you're having red peppers with the beans or something that's a good source of vitamin C and organic acids, and then you're wanting to minimize those inhibitors of absorption.
And lastly, since you can only absorb so much iron at one time, you might increase your iron absorption by having it 3 times a day at every single meal rather than just once a day. Because you're limited to how much you can absorb at one time. So just taking a higher dose doesn't work. You're better off taking a lower dose, but taking it 3 separate times.
And I actually recently had a friend who came up with low iron, and so we decided to try adding lentils to her breakfast. So instead of just a whole grain fruity kind of breakfast, she added lentils. And her iron, it really helped. Lentils are, within each food group, there are foods that are a little bit more concentrated in iron, and lentils in the legume group are a little bit more concentrated in iron.
Just one more thing to the iron question. There may be many factors why women live a little bit longer than men, but some people hypothesize that their iron is a little bit lower. What Brenda was talking about is the oxidant effect, and I think particularly in the brain function, I think excess iron can actually cause some inflammation, oxidative inflammation in the brain. So it's not a goal to have the highest iron, of course, in the room, just to make the point. Sure.
Yes, hello. I want to thank you for all the information, but what I'm also interested in with all the information is how best to get tested, like with some of these levels, like which type of doctor can you go to, if you're not able to go to a facility. And are there, like, I have one specific test I want to ask about, and that's the cholesterol test. I know I was tested once and was told that my LDL was really fluffy or something. I didn't really understand it. But is there a special LDL test? And the other thing is just which doctor do we go to get what we need to be tested?
So this whole area of advanced lipid testing has been sort of controversial within cardiology, within lipidology. We have most of our trials are really focused on just large populations where there's a variety and you're sort of treating the average LDL density. But it is very clear that dense LDL particles tend to drive more plaque development than the buoyant, fluffier LDL. And so the other correlate with that is your triglyceride level. The people who have very high triglycerides tend to have more dense LDL particles. Our last set of lipid guidelines from November from the American College of Cardiology, American Heart Association actually have enough outcome studies to say that we really should be measuring for people in whom there's a question of whether or not they're at risk. It does make sense to measure the LDL density as well as measuring that one little molecule, LP little a, lipoprotein A, which is puts some people genetically at risk for more heart attacks stroke and death, despite having a reasonable LDL. So these tests are actually available. If you went to your doctor and said you wanted a LDL particle size, they could order it from Quest. But there are specialty labs. Probably shouldn't say their names out loud, but you can just Google them and you will find they're pretty easy to access.
What's your view on oxidized LDL?
Yeah, and actually each one of those that does the advanced lipid testing will do the advanced lipid testing as well, or the oxidized LDL.
Yeah, you go ahead. Just, yeah. Yeah, the two at the front there. That's two.
Thank you very much. You guys are a great panel, and it's just amazing to have you all here in our own backyards, and thank you for coming, and thank you for continuing to come. Okay. So my question was, actually, I have one for you, Dr. Fuhrman, and that is, since angiogenesis is such an important aspect of cancer, what foods in particular do you feel are the most angiogenic outside of mushrooms, obviously, to consume, and how would you have them?
Well, the question is about the anti-angiogenic potential of foods.
Right.
Because we know that extra insulin and extra IGF-1, which are growth promoting, promote angiogenesis, and promote cellular replication, which is one of the factors that hormonally drives excess cancer. And the anti-angiogenic foods are the same foods that are high in phytochemicals that protect against cancer. And one of the mechanisms which they protect against cancer, besides their supporting the NRF2 transcription proteins, which fuel the antioxidant response element in the cells. That's one aspect, which flavonoids and isothiocyanates from green vegetables. But these same foods that have the anti-cancer effects have anti-angiogenic potentials. So besides mushrooms, it's berries and pomegranates and tart cherries also have also, by the way, pomegranates have some anti-aromatase activity as well against breast cancer, the same way as tamoxifen does. And mushrooms have anti-aromatase activity as well. And so we're talking about green vegetables, beans, onions and scallions, berries and pomegranate and cherries and some other fruits that probably fit those same categories. And what am I leaving out?
Broccoli?
Broccoli, you said?
Yeah.
Green cruciferous vegetables, yes.
Right,
yes,
absolutely.
yes.
And my other question would be, if you eliminated alcohol, would it help eliminate major issues as far as health goes?
If you eliminated alcohol, it would eliminate health costs, did you say?
Health issues.
Health issues?
Right.
Well, alcohol is a carcinogen. And so, yes, if the population eliminated alcohol, you would save a host of different health problems that would be better in our society. Sure.
Hi there. I was wondering about tofu and soy-based proteins, as well as even wheat gluten for protein, because I noticed that hasn't been mentioned pretty much at all in terms of protein sources.
I think Dr. Fuhrman did mention soy, edamame, and you said tempeh, absolutely. There have been concerns for men that it somehow will feminize you because of the phytoestrogens, and that actually there are case reports, I'm aware of 2 of them, but it took about a half a gallon or more for that to, per day for that to happen. So I'm not sure that's something that's going to happen on a routine basis.
And I would add just think about this. 2 out of the 5 blue zones use soy as dietary staples. So if the healthiest, longest-lived people in the world use soy as a dietary staple, it's probably not poison. But what we need to understand is that I think number 1, we want to choose organic soy, and number 2 is that we don't want it to be overly processed. So we want edamame, soybeans, tempeh, tofu, I think is a good option as well, certainly a common option in the blue zones for sure. And so rather than the soy protein isolate concentrates that we get from protein powders or veggie meats. Not that you can never eat these things, but they shouldn't be a dietary staple.
Just to add to that all the processed soy necessarily produce MSG in the processing. So the wholer you have it, the better it is, because that's a big issue, particularly for brain function and so forth. I think we need to consider that.
Right, concentrated soy protein, not whole soy foods, but the isolated protein can also raise IGF-1 too high, like meat products do.
Right.
And the other thing is if it's not organic, it can be extracted using a compound called hexane, which is a neurotoxin. We're not sure how much of the hexane might remain in the product, but it is a concern and just another reason to choose organic.
And genetically engineered soy is maybe 90% of soy that's out there is genetically engineered, roughly speaking. So you really, if you're going to have soy, you need to go organic.
Hello. Yes, I have a question about 5G and radiation and how it may impact nutrition absorption and your body's ability to digest and get the proper nutrition from your food. And I don't mean just 5G, I mean all types of wireless radiation and how that might affect your body's ability to absorb nutrients and be able to digest them. Thank you.
It's a pretty complicated question. I will mention that there is some research suggesting that, there's a lot of health problems with 2G, 3G, 4G, and 5G. And the suggestion is 5G will be 100 times, literally 100 times worse. One particular thing with the 5G that may be happening is a decrease in melatonin secretion, which will alter our overall physiology. The second thing that I read about in my paper is the Schumann resonance and also, as I said, the global electric kind of beam there. Our whole physiology is affected by that. So when you start altering the global electric circuit or the Schumann resonance, which is what 5G, particularly from the satellites, would do, it's going to greatly affect our whole physiological pattern. So it's kind of an unknown. We know there are diseases that you get from it, but I don't know if they're as specific, at least in my understanding, they're going to have this nutritional deficiency or that. I don't think they're that far in seeing it. I know we have fertility problems. We have, type 2 diabetes is increased. Heart problems are increased. Cancer is increased. There's a lot of major chronic diseases that are activated with the 3, 4, 5G. But the exact nutrient, I'm personally not aware of behind an alteration in the melatonin, decrease in melatonin, which we need for really being healthy and protect against cancer.
Does the addition of mustard in some form to kale, spinach, cruciferous vegetables, does that enhance the bioavailability of its nutrients, especially to cruciferous vegetables?
That's a complicated question. I'll try to explain it as quickly as possible. There's an enzyme in the cell wall of cruciferous vegetables called myrosinase, which is heat sensitive. Myrosinase catalyzes the reaction of the glucosinolates in the center of the cell to the isothiocyanates as the myrosinase capsule is crushed. In other words, as you're chewing vegetables in your mouth, the myrosinase enzyme is mixing with the glucosinolate, forming the isothiocyanates with the powerful anti-cancer effects. The better you chew the vegetable, the more cruciferous vegetable, whether it's broccoli or kale or watercress or arugula or mustard greens, the more anti-cancer compounds that are formed. Myrosinase is heat sensitive. The question is, if you cook the vegetable and destroy the myrosinase, now you have the broccoli and kale in the stomach without producing so much ITCs, and mustard seeds taken on the food could supply some myrosinase to convert some of the unformulated ITCs that are still in your stomach because they haven't been converted that can aid their conversion to the ITCs. Yes, that's possible, and it does happen. That's why we recommend eating some raw kale, raw bok choy, raw watercress, raw arugula on your salad to help you convert some of the cooked green vegetables you're eating, because you have some of that raw myrosinase going into your digestive tract. But better than that even is that when we make a soup or something with cooked vegetables, we blend the mustard greens or the kale or the collards while it's still raw in the blender, so we let the raw myrosinase form the ITCs in the blender. And then we pour it into the soup to cook, because the cooking process doesn't destroy the ITCs, it just destroys the myrosinase that would have formulated the ITCs. So you can still eat cooked cruciferous vegetables in your stews and your soups if you blended them when they were still raw. But yes, adding mustard seed or arugula or watercress or other cruciferous vegetables raw do get you help a little bit of the conversion from the cooked greens that you ate. But also, that's when we wok vegetables, when we wok cabbage and broccoli, we use a timer on our phone, or we do it for only 5 to 6 minutes. We don't keep overcooking the vegetable, because you still get myrosinase activity in broccoli and cabbage when you wok it for 6 minutes or less. It's when you cook it from 6 to 10, or when you make it soggy and mushy, or you really overcook it, that you destroy all that activity. So a combination of factors we're using in the cooking method to maximize the intake of those foods. Is that what you're referring to? Yeah, you're welcome.
Thank you all for being here. My question is the relationship between lectins and legumes. Can you explain whether it's not so good, or got to get rid of some of the lectins? Thank you.
Brenda, you do that one.
Well, lectins are fairly prevalent in the food supply. In almost all foods, there are some lectins. And these are compounds that can cause blood cells to agglutinate or kind of stick together. And they can be problematic if you're eating a fair bit. And there are all kinds of different lectins. Some are damaging to health. Others are actually very protective against cancer. There's one lectin they're doing research on in Japan that they're actually thinking of using as a kind of a therapy for cancer. So there are all types of different lectins. However, the lectins in legumes, especially large legumes, now the ones in small legumes and peas tend to not be so problematic, but the ones in large legumes like kidney beans, there are these lectins called hemagglutinins, and they're really quite potent. And so a lot of people are selling these books that, like the Plant Paradox, for example, they're saying, you've got to avoid these foods because they contain lectins. But the reality is, when you soak legumes, you get a significant reduction in these compounds. But when you cook them, you pretty much completely destroy the lectins. I mean, not 100%, but certainly the vast majority, well over 98%, are generally destroyed if they're adequately cooked. And so these, these pressure cookers, the instant pots, and these kinds of cookers, you're going to get even more destruction. And I think of the lectins, which is to me, it's just not a concern because we cook these beans before we eat them. And the only study I know of that showed, very bad adverse effects from eating kidney beans was a study in a hospital where they fed the patients undercooked kidney beans, and you get really sick if you eat undercooked kidney beans. It's like food poisoning. So otherwise, I just don't think it's something most people have to worry about.
There is some research of linking certain sensitivity to certain lectins to your blood type. And type A's will be more susceptible to the beans. Type O's are not going to be affected so much by it. So there's another little factor in there, if you can follow what I'm saying. Without getting into the whole thing, but there's certain foods that, for example, type O's, some of the research suggests, are more sensitive to the lectins in sunflower seeds. Type B, to the lectins in sesame seeds, and type A really being quite affected by the beans and legumes. So that's another factor.
Could
to
you,
think about.
I'd love to see those studies, because that's not something I've ever.
There's a whole book on it.
I know there's a
Yes.
whole
No,
book
no,
on it,
not
but
that
the book
book.
has
Not-
been.
No,
has
not that
been
book. That book has been
scientifically
debunked.
invalidated.
No, this is a book that's only talking about lectins, and I'll think of the name, but it's pretty solid type research.
Let's just say, though, that there's no blood type that doesn't live longer from eating beans. Did you follow that? All blood types of all populations around the world live longer when they eat more beans in their diet. So lectins can't be that bad. And they're not, actually. There's no data to really...
But-
we have to have an hypothesis, but you have to prove that hypothesis now with some long-term studies, and all those studies looking at lifespan with hard endpoints, so that people who eat more beans live longer.
But people tend to want to do things raw, and truly, you gotta cook the beans. That's just simple, because the antitrypsin, the antihemoglobin factors that you kind of mentioned, they are destroyed with the heat. So if you're going to do beans, you've got to cook them, not just sprout them. Beans are legumes.
As there's been talk about doing away with Obamacare, as medical doctors, what are the major changes that you would like to see to the current health system to support better health?
So let me take that one on. We fought really hard. So we fought really hard to get the affordable health care passed, and the number of people who are uninsured in this country has gone down dramatically, and then any of the reversals have actually increased those numbers lately. And so having the ability to have health care really does make a difference. Having the ability to go someplace and not wait as long before you present for your illness can actually change the outcome of that illness. Having said that, there never has been, even though Medicare, the way it was designed with the MACRA law, which was passed about 3 years after the ACA, MACRA was trying to redesign Medicare for quality and for alternative payment models. And in those alternative payment models represents, I think, an opportunity for people who do prevention to carve out diseases such as patients who have a heart attack and come in and have a stent. And there's a certain amount of cost expenditure that happens by Medicare on average over the next year or two. Why not bundle those successfully and focus on lifestyle change? If you can take that person and change the way that they're eating right there in the coronary care unit, sign them up for phase 1 cardiac rehab, and then phase 2, have them successfully complete one of those, particularly the advanced, now that Medicare pays for them, one of the advanced cardiac rehabilitation programs, you will drop the healthcare costs significantly. And with Medicare, you can actually do that as a shared savings program, and it'll be better for the institution and for Medicare, and obviously for the country.
I have a little different idea. My idea, instead of waiting till a person actually has the stent, to actually teach nutrition in elementary schools and make it a required curriculum, that it's reading, writing, arithmetic, and nutritional science, because it should be something that's taught all through the educational process, and not expect doctors to be able to teach people nutrition. Everyone should know about nutrition and not wait till they have a severe medical problem to realize it's something they should have learned about. So
that's why I honor this group for paying attention and being so interested, because you need to do that to protect yourself.
And I'd just like to make a comment there as well. I mentioned that I had done research in the Marshall Islands, where they have the highest rates of diabetes in the world. And after we did the research, I continued to go back to do interventions for the politicians and the police officers and the teachers and so on. And the last time I went to the Marshall Islands, I was asked to go there to create a nutrition curriculum for grades 1 to 6. And I worked 3 weeks, 16-hour days, and wrote a 150-page curriculum for them. Thank you. Not only that, but we trained every single teacher in every single public school before we left. So it was a big project. But I just, it's exciting to see, just a small country like that, but to actually recognize how important it is to start there.
Yeah.
Right.
Okay.
Other countries are doing more advanced things like that. I went to the Bahamas too, when they spoke to the Department of Health there, and they're producing their food plate and telling you and giving people advice to the whole population to try to improve healthcare costs with much more aggressive nutritional and trying to teach all their educators in schools and having a much more broad spectrum affected health that addressing cause than we do in this country.
Yes.
So I'd like to conclude with each of you giving a 1-minute final thought on anything you'd like to say. I just want to also let everyone know that tomorrow at 9 a.m. Vandana Shiva is speaking. At 11 o'clock, Dr. Fuhrman is speaking. A nutritarian diet is the most effective, healthiest, and sustainable way to resolve obesity and diabetes. At 2 o'clock, Dr. Kim Williams is speaking, Nutrition and Heart Disease, the etiology of cardiovascular mortality. And at 4 o'clock, Brenda Davis is speaking, Designing a Bulletproof Plant-Based Diet, Focus on Nutrients. So I hope everyone will come back tomorrow for the final day to see them. And if you could each conclude with your 1-minute final thought, and then we'll serve the vegan ice cream. I do want to let everyone know that we clearly are not recommending the vegan ice cream. It is soy ice cream. It's high in sugar. We serve it to get people to come to the conference, but in no way is it recommended.
But you have to consult your physician before you eat it.
Which way do we want to start? This end? Well, I guess the thing that I would like to say is it really is an honor and a privilege to be here and to meet so many people who really care about their health, the health of their families. And I know that we're not all at the same place in our journey. But to me, just being at a point where you recognize where the direction you want to go is 90% of the battle. And even if it's just one step at a time, just keep moving in the right direction and sharing what you can share in a way that is filled with love and compassion for the people around you. And I think that's the most, with the greatest tool any to influence those around them is really their own example. So just be the best example that you can be.
Thank you very much. I talk about it a lot. Did really have a career goal wanting heart disease to not be the #1 killer of Americans. It's been over 100 years. I'll talk about that more tomorrow afternoon. And my message, for if I had just 60 seconds, is to thank everybody who's here, thank everyone who's online. You're here because you're concerned, and that concern can spread. You've got to be an advocate. You've got to be scientifically sound in what you're talking about. I encourage everyone to evaluate everything that we're all saying in the light of real randomized trials. And if the randomized trials aren't there, let's do them. We need more and more solid evidence so we can change guidelines, educate physicians, change schools, change even churches, change all of our institutions, get the hospital food to actually improve. And if we work on the political aspect of changing the health direction of this country, people will argue that you shouldn't have seatbelt laws because that decreases personal freedom. Well, if a person is injured and it's going to take our tax dollars, then you don't really have the right to not wear your seatbelt. The same thing's true of food. People who are overeating are actually taking away resources from other people. So everyone should be a thin, exercising daily, plant-based person and take it as your responsibility to save the finances of our healthcare system. It's your patriotic duty.
I just want to acknowledge everyone here for being so interested, so turned on to loving yourself enough to want to heal yourself. Okay, that's a good start. I also really want to thank Steve here for doing a great job.
Thank you. Thank you.
And I really enjoyed being on this panel. Really good, really top line. This is really, really good stuff. Thank you.
Thank you.
Thank you. Good.
I, of course, support everything that was being said. This has been a real positive experience for all of us concerned here, and that nutritional science and is a blessing for all of us to not just reverse disease, give us the power to control our health destiny, but also for our families, for our future, for not to have children being dependent on us, to really have a happier future, and to lose that fear that more conventional approach and conventional medicine breeds in people, the fear of being sick, the fear of being in a hospital, the fear of being tortured, being uncomfortable. We really can take control of our lives and have a much happier life, much more hope, and much less suffering, and a better quality of life because of advances in nutritional science, which we all really appreciate.
Great. So I just want to end with a blessing. Vinanda Shiva was talking about the importance of seed and the importance of how everything is connected to everything else, the quantum understanding. And so I want to bless everyone here that we understand that we are a seed to expand and uplift the consciousness on the planet and may be blessed and sprouting really well. Aho.
Thank you.
Very good.